Hello. Hi everyone. Hi everyone. Good evening. Am I audible and visible, everybody? Just give me a heads up. Hi everyone. Good. Okay. All right. So good evening, everyone. Welcome back to this session on NEET PG 2023 PSM revision. Okay. Now, of course, PSM is a huge subject. We have with us 2 to 2.5 hours where I'm going to try to cover most of the important topics which would come in your NEET PG exam. Okay, it's an MCQ, an entirely image-based session, and towards the end, I'm also going to give you certain updates, guys. Okay, towards the end, I'm also going to provide you with certain updates. Okay, so I'll give you those towards the end as well. All right. So without much ado, let us start. So I will be covering EPID, biostats, screening, some important points from health programs, some diseases. All of that we'll be covering in today's session. Okay. All right. So let us start. So look at the first question. First, we are going to tackle epidemiology. Okay. And I'll be taking up your doubts towards the end, so you can, keep your doubts towards the end. I'll be addressing 5 to 10 minutes of doubts as well, all right? So you can keep them towards the end. Just sit down, relax. I will also be sharing the PDF, okay? So let us start. Best study of choice for assessment of unknown or new disease with no hypothesis. What is your answer? Everybody think carefully. It's a new disease. It's not known to us, okay? There is no etiological hypothesis, guys. Will you do a cohort study? Most of you are answering cohort. No. When COVID happened, did we know it was COVID? We were calling it as pneumonia of unknown origin. So what is the thing that we do for the very first time? We first describe the disease, everybody, okay? When nothing is known about a disease, what is the first thing that we do? We first describe the disease, okay? So here nothing is known. Like first we had pneumonia of unknown origin. We described it that it's happening in China in winter months, okay? So what is the answer here? Not cohort. Dhyan se dekho. Unknown or new disease with no hypothesis. The answer is descriptive. So here I would like to revise the first thing, which is classification of study designs. Let's all revise it together. How do you classify the study designs, everybody? Batao. What are the two broader headings? The first thing that you're going to do is you're going to meet someone, so you're going to observe them. Observational. Then next thing, आप कोई intervention करोगे, you will start talking, so experimental. ठीक है? Observational में what are the two headings? Tell me in observational. In observational, it is descriptive, okay? And what else? Descriptive and analytical, okay? What do you do in descriptive study design? You have to describe the disease in terms of time, place and person, okay? You have to describe in terms of time, place and person. So हम लोग क्या पढ़ते हैं descriptive में? Very good everybody. हम लोग descriptive में क्या पढ़ते हैं? Distribution. And what do you do in analytical study design? You answer why the disease occurred, how the disease occurred. So what are you doing? You are trying to compare. In analytical, always you will have a comparison group. So can you give me some examples of a descriptive study design? Everybody, descriptive का कुछ example दो. It is case report. And it is also case series. What about analytical? So for analytical, you have cross-sectional, okay? What else do you have? Ecological. What else do you have? Case control. And which one do you have, everybody? You also have a cohort study design. Okay, so in observational, you have divided it into... Just a second. Yeah. So in observational, we have divided it into descriptive and analytical. And what about experimental, everyone? What are the types of experimental study designs? So the first one is randomized control trials. Okay. This which are drug trials. The second one is which one? The second one, everyone, is field trials. Field trials क्या होता है? Vaccine trial. All right, and the last one is the community trial. So community trials क्या होते हैं? Preventive trials. Okay, so when nothing is known about a disease means you have to formulate a hypothesis. So when we have to formulate a hypothesis, guys, which study design will we use to formulate a hypothesis? To formulate a hypothesis we will use a descriptive study design. ठीक है, to test a hypothesis हम लोग क्या use करेंगे? To compare, that means analytical, and to confirm a hypothesis what are we going to use? Experimental. Thumbs up everyone. Did you understand this question? So there was nothing which was known about a disease. It was a new disease. So when the disease is new, the first thing that you have to do is you have to describe. Okay, so answer of this question was descriptive epidemiology. Okay, chalo. Moving to the next one. Okay, here I would like to write again a golden point. ठीक है, that all study designs have what as unit of study? All study designs have individuals as unit of study. Okay, they have what? Individuals. All study designs have individuals as unit of study, except which one, guys? Except ecological. Why? Because ecological में unit of study क्या होता है? Ecological में the unit of study everyone is population. Is it clear? ठीक है, that's again a golden point. Let's go to the next question. Right now we are doing epidemiology. Let's read this. Chalo, tell me about this. British investigators conducted a study to compare MMR vaccine history among 1 to 9 children with pervasive development disorder, okay, and 4469 children without such disorders. They found no association. This is an example of, what is this? An example of P. Here we are going to tackle all the MCQs with images. Okay, that's how we are going to revise our topic. Okay, everyone, that's how we are going to revise the topics. All right, we'll be looking at some conceptual MCQs. In FMG marathon we couldn't take up the MCQs. Okay, so here we'll be looking more at MCQs. All the topics with the help of MCQs we'll be targeting. ठीक है, चलो. So now what is the answer to this? Okay, what are you marking? Okay, most of you are saying it is option C. Okay, some of you are saying it is option B. Now look, in this type of question, what do you have to do? The first thing that you have to do is you have to figure out what is the exposure and you have to figure out what is the outcome. So what is the exposure that we are studying over here? Exposure क्या है? Exposure is the vaccine, all right, and the outcome over here is the autism or Asperger's, Asperger's, whatever. So it is the development disorder. Okay, that is the outcome. Plus there is a very important word over here which says history. So that means we are going back, everyone. Okay, where are we going? We are going back. Now in this you can see that you have two very important groups, 1 to 9 for children with the development disorder and 4469 children without such disorders. So you have already been given the children with autism and you have already been given the children without autism. So all you need to go is go back and ask them about whether they used MMR vaccine, not used. Similarly, whether they used MMR vaccine or not used. Clear? समझ में आया सबको? There was a buzzword there which said history, right? So you are going back and you already have two groups with you, which is children with autism and without autism. So what is this study design? Case control study design. ठीक है, so what do you have to figure out? What is the exposure, what is the outcome, what is the direction, and what are you comparing? Yes, so now look at this image. Can you all see this image? ठीक है, this is case control study design का image. You start at the present time, you are always comparing cases and controls, and then you are going back to look at the exposure status. Now what are the golden things which come from case control study design? Can you tell me what all will you look for if you have to study rare diseases? आप कौन सी study use करोगे? अगर आपको रेयर डिजीजेस पढ़ना है, ओके, लाइक कैंसर्स, लाइक डिप्रेशन, ऑल दीज थिंग्स, यू विल यूज अ case control. Okay, if you have to study multiple exposures, which study design will you use? अगर आपको multiple exposures पढ़ना है, again you will use a case control, because you can start with lung cancer cases, no lung cancer, and you can go back and ask about so many things. So multiple exposures, case control. ठीक है. Another question which can come, what are the types of bias you see in a case control? Tell me, कौन कौन से bias देखने को मिलते हैं? So most important, you see recall bias, you see interviewer bias, okay, also you see selection bias. These are the most common biases that we see in a case control. Fourth golden point, what is the measure of strength of association in a case control? बताओ, what is the measure of strength of association for a case control? What is the measure of strength of association? Don't forget odds ratio, or you could also call it as cross product ratio. And what is the formula for odds ratio, guys? Formula for odds ratio क्या है? AD upon BC. ठीक है. So with one example, with one question, we were able to solve so many points regarding that particular topic. ठीक है. Now look at this question, everybody. Let's look at this question. The Iowa Women's Health Study, in which researchers enrolled 41837 women in 1986 and collected exposure and lifestyle information to assess the relationship between these factors and subsequent occurrence of cancer. Is the screen hazy for everybody? We'll work upon it. Is it hazy for everyone, guys, or is it okay? Can I continue? I think you could also refresh it at your end once, maybe. All right? Chalo. Okay. All right, चलो let us look at this. Now, हमेशा study design में guys figure out what is the exposure and what is the outcome. बिना वो figure out किए आगे मत बढ़ना, ठीक है? You have to figure out what is the exposure and you have to figure out what is the outcome. So tell me, what is the exposure over here? You have two groups of, you have a woman enrolled 41837 women, okay? So you have so many women, and you are collecting exposure and lifestyle information. So what is the exposure? Lifestyle information. And what is the outcome? Cancer. Now just tell me, are you moving forward or are you moving backward? बताओ, तुम forward जा रहे हो या backward जा रहे हो? So this is a group of women. You have taken lifestyle information with them. Okay, let's say we are talking about alcohol, no alcohol, and what are we studying, guys? Subsequent occurrence. Simple English word. Matlab we are moving forward and we are studying what? Cancer, no cancer. ठीक है? Subsequent occurrence of cancer, no cancer. So it was clearly mentioned that we are moving forward in direction. So what is your answer over here? Experimental, cohort, case control, clinical trial, ecological. The answer is cohort. Is it clear? We were moving forward in direction. ठीक है? Subsequent occurrence मतलब forward जाना. So now tell me some golden points about cohort study. Can you see from this image, everybody? इस image को ध्यान से देखो. You start at the present time. You've divided your participants into factor present and not present. Means you are comparing exposed and you are comparing non-exposed. And then the direction is going forward to look for the disease. Okay? So, which type of study design it is? The name is prospective cohort. What is the other name for this? Concurrent cohort. Okay. What else do you call this? Forward looking study. Is it cause to effect or is it effect to cause, guys? Cause to effect है या effect to cause है? क्या है ये? So you are going from cause to effect. Again, very important. And what can you calculate from a cohort study? Do you calculate incidence or prevalence? क्या calculate करते हो? Cohort study से everybody. So from the cohort study, we can all calculate incidence. Okay, remember that. What can we calculate from cohort study? We can calculate incidence of a disease or anything. So that is incidence study as well. Okay, so you figure out exposure kya, outcome kya, are you moving forward, are you moving backward, and accordingly mark your answers. ठीक है, very good, that we'll be doing. What are the measures of strength of association in a cohort study? Quickly tell me, what are the measures of strength of association in a cohort study? So we all know there is one thing which is known as relative risk. What is the other name for relative risk, guys? The other name for relative risk is risk ratio. Okay, all right. You just focus right now. I will share the PDF on the Telegram group. ठीक है, अभी बस ध्यान दो. Relative risk का formula क्या है, everyone? Incidence among exposed. Okay, we'll be looking at a question of this. This has come last time only as a PYQ. Okay, incidence among exposed divided by incidence among non-exposed. Okay, and what could be the values of relative risk? More than 1 will mean what? Positive association. Equal to 1 will mean what? No association. कोई association नहीं है. And less than 1 will mean what? Protective factor. Okay, less than 1 will mean protective factor. I'm sure you know this. ठीक है? Okay. What about attributable risk? You have a question on this also as we proceed forward. Okay, what is attributable risk? Incidence among exposed minus incidence among non-exposed, everybody, divided by what? Divided by incidence among exposed. ठीक है, that is what is attributable risk. Alright, odds ratio dark night is calculated for a case control study and relative risk is calculated for a cohort study design. And population attributable risk का formula बताओ. Incidence among total population minus incidence among non-exposed divided by incidence among total population. But most commonly, what are you going to get in exam? The interpretation of relative risk. One more point I want to tell you, that if you have to study multiple outcomes, कौन सी study चुनोगे? फटाफट आना चाहिए. On your tips it should be. Multiple outcomes के लिए कौन सी study design होती है? For multiple outcomes, which study design are you going to study? So alcoholics, non-alcoholics, go and study about cancer, CVD, whatever you know. Okay, cohort. Multiple exposures, case control. Multiple outcomes, cohort. Thumbs up everyone, so far so good. चलो, अब बताओ ये क्या है? Let me see who can answer this. Okay, can you see this image, everybody? अब ये बताओ, which image is this? Look at this image carefully and see what are you comparing. Can you tell me? Start of the study देखो. Look at the comparison group and the direction. Is it a prospective cohort? Is it a case control? Is it a non-concurrent cohort, or is it a cross-sectional? Who can tell me what is this? When are you starting the study? देखो, you are starting at the present time. Okay, any answers? Any answers? It's the same MA. Okay, odds ratio more than 1 is positive, odds ratio equal to 1 is no association, and less than 1 is negative. Abhi I'll give you an MCQ of that MA. ठीक है, in just a while MCQ मिलेगा, उसमें देखते हैं. Very good everybody. Why are you saying non-concurrent cohort? Very good. In fact, it is definitely a retrospective cohort. Very good guys. कैसे पता किया आपने? How did you know? See, we started at the present time. But what are we comparing? Are we comparing cases and control? No. हम लोग पीछे गए हैं and we have divided the employees of tire manufacturers into tire makers, which becomes exposed, and clerical staff जो हो गया तुम्हारा non-exposed. And again you've come forward to compare incidence of death. So since it was written incidence, it means we are using a cohort study. But we are not moving forward. We have gone first backwards, divided into exposed and non-exposed. So this is a non-concurrent cohort. It's not a case control. Case control में आप क्या compare करते? Cases and controls. We are not comparing cases and control. Is it okay? Everyone, ठीक है? Now look at this image. Look at this. Can you all see this image? Now look at this. Can you see this? Can you see this next image? I'll take up your questions at the end. Okay, Dr. Drago, nested case control is a prospective in nature. That's a slightly different design. For NEET PG right now, we are focusing on prospective cohort and retrospective cohort. At the end, I'll address for you what is nested case control also. अब इसमें देखो, what is this? Which type of cohort it is? You are starting at the present time. You've divided into obese, so this is exposed, lean, this is non-exposed, and फिर आप क्या कर रहे हो? You are moving forward to compare the incidence. So this becomes what? Prospective cohort. Okay, this becomes what? Prospective cohort. Is it clear? So look at when you are starting the study, what are you comparing? Whenever you compare exposed and non-exposed, it will be cohort. When you compare cases and control, it is going to be what? It is going to be your case control. Okay? अब ये वाला image देख लो, it will become very clear to you. Just have a look at this image once. You start at the present time, you compare cases and control. This is case control. ठीक है? You start at the present time, you go back, divide into risk factor present, not present, and then you compare incidence. This is retrospective. You move forward, this is a prospective cohort, and in clinical trials क्या होता है? Patients आ जाते हैं, so that becomes a clinical trial. ठीक है? Everyone? Okay. चलो, look at this question now. Can you see this question, everyone? Okay. Residents of 3 villages with 3 different types of water supply were asked to participate in a study to identify cholera carriers. Okay. Because several cholera deaths have occurred in the recent past, virtually everyone present at the time submitted to examination. Okay? The proportion of residents in each village who were carriers were computed and compared. Which type of study is this? Is it cross-sectional? Is it case control? Is it concurrent cohort? Is it a non-concurrent cohort? Try to figure out. ये क्या है? Why? Why is it a cross-sectional study design? Most of you are writing cross-sectional. But क्यों? Reason क्या है? सबसे पहला reason guys क्या है? There are 3 different villages. Okay? There are 3 groups. It's not the same group. When it's not the same group, it cannot be a cohort. Okay? It cannot be a cohort. And everything is happening, virtually everyone present at the time submitted to examination. So it's happening at the same time. We have gone to this village, we have gone to this village, and we have gone to this village. And we have just computed the carrier state. So this design is happening at one point of time. Okay, so the answer to this is a cross-sectional study design. I'm just trying to show you for each of the study design how the question will come. Okay, that is what we are discussing right now. Okay, so over here you are having 3 different groups. So when you have 3 different groups or 4 different groups and you're comparing them at the same point of time. So this is cross-sectional study. Okay. Now, what is the advantage of a cross-sectional study design? Look at this. Look at this. Can you see this cross-sectional study? Can you see anywhere the arrow? Are we going forward or are we going backward? कोई ऐसे arrow दिख रहा है तुम्हें? नहीं. So what are the points of a cross-sectional study design which are very, very important? That you determine exposure and outcome. When you determine exposure and outcome at same point of time. ठीक है? You are neither moving forward nor backward. That's the first thing. Okay. Second point is what? It will help you calculate what? Prevalence. Very good. Prevalence. Incidence cohort है. Cross sectional study क्या calculate करेगा? Prevalence. The biggest disadvantage of a cross sectional study is what, everybody? The biggest disadvantage. What is the biggest disadvantage? That it cannot establish temporality. Okay, can it say that cause precedes effect? Can it say? No. Because I am asking, I can ask you right now, how many of you smoke? I can ask you, how many of you suffer from hypertension? अगर तुम मुझे बोलते हो मैम आई स्मोक, आई ऑल्सो सफर फ्रॉम हाइपरटेंशन, कैन आई से दैट स्मोकिंग हैज लेड टू हाइपरटेंशन इन यू? No. So that is the meaning of it cannot establish temporality. We cannot say that cause precedes effect. Okay. And what is temporality? Temporality means that cause precedes effect. Okay. It is the most important Hills criteria. ठीक है. सबसे important Hills criteria is which one? The most important Hills criteria is temporality. ठीक है. And in a cross-sectional study, we rely on primary data, meaning as an individual, as a researcher, I am going to collect data. Got it, everyone? ठीक है? So prevalence study is cross-sectional. It's like taking a picture of a population, a snapshot of a population. Now look at this question. Can you tell me which study design is this? Plausibility अनुभव मतलब होता है ना biological plausibility. Like when I say that smoking is leading to lung cancer. Now does it have a biological reason behind it? Yes. Smoking will cause inflammation of the lung parenchymal tissue. ठीक है अनुभव? So that is the meaning of plausibility. A support, a biological backup. ठीक है? Okay. What is the answer over here? Question पढ़ा सबने? Question पढ़ा, obviously we are left with ecological, that doesn't mean answer ecological हो गया, but question पढ़ा, did you read the question? A research group designed a study to investigate the epidemiology of syphilis. The investigators examined per capita income and rate of syphilis in Delhi, Hyderabad, Noida, Mumbai. So data on city-wide syphilis rate was provided by each city's health agency. So what are you studying? Are you studying individuals or are you studying countries, populations? Batao, what are you studying? Are you studying individuals or are you studying populations or cities? Obviously, you are studying population. So the moment we study populations, okay, the unit of study over here is a population. It's a town, it's a city. The answer becomes ecological study design. Plus, from where are we collecting the data? From the city's health agency. That means we are collecting the data from, it's a secondary data. Okay, I am not collecting the data myself. It's a secondary data. Already collected data को मैं use कर रही हूँ. So this becomes an ecological study design. Clear? So what are the features of an ecological study design? What are the other names for an ecological study design? ये image आएगा for ecological study design. Okay. Here look, we are studying different countries per capita daily meat consumption. In those countries which are more, they report higher colon cancer incidence, है ना? So this is what we are trying to study over here, ecological study. Now this is actually with statistical diagram. Can anyone tell me is statistical diagram का नाम क्या है? Is it a bar chart? Is it a histogram? Is it a pie chart? What is it? Very good, Divya. Yes, in a cross sectional study आप क्या collect करते हो? Primary data. Absolutely correct. Okay. But in an ecological study, we rely on secondary data. What is this? We will be seeing as we proceed in the lectures. It is a scatter diagram. Okay, it is a scatter diagram. Ecological study ko we also call it as a correlational study. We also call it as a population study, guys. ठीक है? Correlational study बोल सकते हो, population study बोल सकते हो. You also call it as a geographic study. You also call it as a aggregate study. And what is your unit of study over here? The unit of study over here, everyone, is a population. Please remember this. And we are relying on which data? We are relying on secondary data, already collected data. So here in the question we were taking data of cities. Okay, so that is what is ecological study design. So what is the similarity between cross-sectional and ecological study? Both are done at the same point of time. But if you use primary data, it is cross-sectional. If you use secondary data, it is ecological. ठीक है? Clear everyone? Can we move forward? Thumbs up everybody, understood? चलें आगे बढ़ें guys. Okay? चलो. Alright, now since you have seen most of the study, try answering this question. An investigator suspects that acetaminophen used during the first trimester of pregnancy can cause NTDs. ठीक है? She estimates the risk of NTD in the general population to be how much? 1:1000. What is the best study design to investigate this hypothesis? Can anyone tell me? The best study design to investigate this? ध्यान से पढ़ो. Again, what is the exposure that you want over here? What is the exposure? The exposure that we want is acetaminophen, right? It is acetaminophen. And what is the outcome that we are expecting over here? NTDs. Now, NTDs are very common or very rare? Obviously, it is rare. 1:1000. Not every child is a victim of NTDs. So, what is the best thing to do over here? Since it's a rare disease, guys, आप क्या कर सकते हो? You take the population, you divide it into children with NTD, no NTD, and then you simply go back and ask about whether the mother took acetaminophen or not. Okay, you can't do a cohort because you can't allow her to take acetaminophen. No drug. Okay, similarly, did she take the drug? Did she not take the drug? So it becomes a case control. Clear? Okay, here we were talking about a rare disease, everyone. So it became a case control study design. ठीक है? चलो. All right. Now, okay, I think we can do this. Look at this question. In a study of rare disease के लिए case control है, rare exposure के लिए cohort है, ठीक है? Now there's a study of 400 smokers and 600 non-smokers to find out incidence, calculate risk ratio. Just look at this table. Can you all look at this table, everybody? Can you all look at this table? सिर्फ table देखो. यहाँ से मुझे risk ratio बताओगे calculate करके, even if I have not given you the options. Can you all calculate the risk ratio? We'll just do one numerical, you know, so that you get into the habit of it. बताओ, hypertension, yes, no, smokers, non-smokers. So can you tell me how will you do this? Okay, so why am I getting all different answers? Chalo, what is risk ratio? First of all, you need to remember risk ratio is relative risk, right? So it is what? Incidence among exposed divided by incidence among whom? Among the non-exposed. ठीक है? So now how many are smokers? 280 plus 120. So what is that? 280 plus 120 would be how much? Here it was written for you also that there are 400 smokers and there are 600 non-smokers, everybody. ठीक है? ऊपर लिखा हुआ था. So what is the incidence among smokers? There are 400 smokers. So when you have to do relative risk, there are how many smokers? 400. Out of them, how many suffer from hypertension? 120. And what are the non-smokers? How many are non-smokers? So there are 600 non-smokers. Out of them, how many suffer from hypertension? 30. So if you calculate this, 120 by 400 into 600 by 30, कितना हो जाएगा आंसर? What did your answer come? 6, right? Your answer is going to be, what have you calculated? This will be 120 by 400 into 600 by 30. All right, so you can easily calculate this. It's going to, what is your answer, everybody? 4:1 bolo. Yeah, so the answer will come out to be 6. Okay, so now what does this mean? If the answer is 6 matlab the relative risk is more than 1, so it is a risk factor. If you smoke, you are at 6 times at risk of whatever we were studying, hypertension. ठीक है? Alright, please don't get confused. ये A होता है, B होता है, C होता है and D होता है. Less chance you will get a numerical, but still. Okay, this is a question that is expected. Read this. A study found odds ratio of maternal hypertension to have IUGR fetus to be 1:5. What is the interpretation drawn? What is the answer to this? Odds ratio आया है 1:5. What is the answer? Guys, ध्यान से 1:5. 1:5 बेटा, 1:5 मतलब 1:5 मतलब okay, Sangeeta has given a different answer. 1:5 matlab more than 1. 1:5 matlab, guys, a tricky question. 1/5 and 1/5 matlab क्या होता है? 0.2. That's how they will trick you. So what is the odds ratio? 2 कैसे हो गया? 0.2. So what is the odds ratio? It is an inverse association. Did you understand? It is 1:5. It is not 1 or something. 1.5 नहीं है. बिल्कुल ये गड़बड़ मत करना. This is what happens when we are in a hurry sometimes. Okay? So what happens? It is 1:5. 1:5 मतलब 0.2. 0.2 means it is less than 1. So what is your answer? Inverse association. Inverse association also means that it is protective factor. Okay, inverse association also means that it is protective factor. Got it? Okay. Next question. Chalo, let's try out this one. Option A, B, C, D. This is a PYQ. I want all of you to read it once. While launching a new national health program and policy, population attributable risk was calculated. So what is the thing that best defines population attributable risk? Can you do it? Yes. Very good. पहला वाला क्या है? Incidence among exposed is so many times higher as compared to that among non-exposed. This is relative risk. What is the second one? So much disease can be attributed to the exposure, attributable risk. And this one is population attributable risk. If smoking is eliminated, there will be so much annual reduction. मान लो population attributable risk came out to be 90%. So if we eliminate smoking, there will be 90% reduction in annual incidence of lung cancer cases. ठीक है? I just wanted to do the interpretation one. Am I clear, everyone? So far so good? चले आगे. ये क्या study design है? Quickly identify and tell me. Suppose you get this image. What are you going to mark this as? What is this study design and how is it different from the previous ones that you have seen? Look at this. It is patient. So what is this? You're giving one group treatment and one group placebo. So this is a cohort. कैसे होगा? Patient आ गया है. You are doing an intervention. You're doing an intervention. एक group को तुम drug दे रहे हो and the other one you're giving a placebo. So this is a RCT. That is why you should be very careful. This here, your group of study is a patient. So this is an RCT. Now one more question. What is the meaning of random in RCT? What is the meaning of random in randomization controlled trials? Okay, so random means that random matlab haphazard, but here it means something which is very disciplined. Every participant gets an equal and known chance, guys. ये भी MCQ है. Okay, this is also a PYQ. Every participant gets an equal and known chance. Never say unknown and unequal. Wrong. Equal and known chance of going into the treatment group or the placebo group. So what is it eliminating? Number one, it eliminates, which again comes as MCQs, selection bias. Okay, it eliminates selection bias. And number two, it eliminates known एंड अननोन कन्फाउंडर्स, ठीक है, दोनों एलिमिनेट करता है, सिलेक्शन बायस एज वेल एज नोन एंड अननोन कन्फाउंडर्स. विल यू रिमेंबर दिस एवरीबडी? ठीक है. Matching eliminates what? In which study design do you do matching? So just for your revision, if you see the word matching, matching is a buzzword for case control study, and matching is eliminating only the known confounders. Matching is eliminating only the known confounders. Very good, Omar. It ensures comparability. Yes. Okay. Clear? चलो आगे एक और क्वेश्चन करते हैं. स्लाइटली बिग. आई वांट टू सी हाउ मेनी ऑफ यू कैन फिगर आउट दिस. टेक योर टाइम, रीड इट. ठीक है, थोड़ा सा बड़ा क्वेश्चन है, कोशिश करो पढ़ने का. A 3-month-old, it's not difficult. It's not difficult. Maybe tricky, not difficult. ठीक है. A 3-month-old boy is brought to the emergency department by his parents after an episode of cyanosis and muscle hypotonia that resolved after 2 minutes. Diagnostic evaluation fails to discover an exact etiology, so it is classified as Brui. ठीक है. The risk profile for Brui in infants, we are not aware of that. Okay. The pediatrician who saw the boy in the emergency department is trying to identify the risk factors. She is aware of several confounders. It could be age, socioeconomic background, all those things. So she recruits 75 infants under 1 year with Brui and 75 without Brui. So you have got two groups over here. This 75 with Brui cases and 75 without Brui control. ठीक है. So which study design is it? Very good guys. Which study design is it? Case control. She then compares the two groups with regard to history. History matlab we are going back, right? Alright, so which of the following methods were conducted to control confounders? So as soon as you figure out that it is a case control, we know the answer to this was, क्या लिखा है तुमने? केस कंट्रोल में कौन से टेक्निक से we eliminate confounders? Everybody, by matching. Yes, matching. You immediately figured out this was a case control study design, so you can eliminate confounders by matching. So your answer becomes matching. What is blinding, guys? Blinding eliminates, always remember, bias. Blinding eliminates bias. What is the buzzword with bias? They are nothing but systematic errors, guys. Okay, they are nothing but systematic errors. Which is the best form of blinding, everybody? The best form of blinding is triple blinding. Okay, please remember this also can come. Best form of blinding. कौन सा होता है best form of blinding? Triple. But the most common form of blinding is which one? The most common form. The most common form is double blinding. ठीक है. So here we were easily able to figure out that it is case control. Since it's a case control study design, we will use matching to eliminate the confounders. Don't worry about the length of the question. Sometimes the longer the length, the easier the question is. Okay. One more MCQ from epidemiology. Which study design, I mean what image is this? I just want you to tell me the name of the image. ये कौन सा image है? Yes, what is this image? Look at this. What is this? Very good. Not forest, not forest. This is a funnel plot, and funnel plot is drawn for both systematic review and which one? Systematic review and meta-analysis. Okay, it is drawn for both. What does it check for, guys? It checks for publication bias. ठीक है, क्या check करता है? Publication bias. But how does a forest plot look like? This is a forest plot. As we proceed, we have a question on interpretation of a forest plot as well. Okay, so we will see that जब वो MCQ आएगा. This is a forest plot, or this is also known as blobogram. And where do you draw this? This is only and only drawn for a meta-analysis. ठीक है? All right. So remember funnel plot, remember forest plot. ठीक है. चलो. Now one more question. What is the best study design to establish causality? Can you answer this? This is from the topic of evidence-based medicine, which can come in your exam. A very, very common. So which study design provides the maximum evidence to establish causality. Confidence interval पे question है Sangeeta. As we proceed forward, I will be giving you a question on that. Okay, so we'll have a look at that when we reach to that point. Okay, chalo. So what is your answer over here? Evidence-based medicine. I mean, which study design provides us the maximum evidence to make a clinical decision? कौन सा study design? Some of you are writing D, some are writing E, some are writing C. Okay. What is the answer to this? Let us draw this. Okay. So what is the weakest study design in evidence-based medicine? Descriptive. तो case report. Case report के बाद क्या होता है everybody? Case series. These are what? Descriptive study designs. After that comes analytical, ecological. After ecological comes your cross-sectional. After cross-sectional comes your, tell me which one? Case control, right? Comes your case control. फिर क्या आता है guys? Cohort. So which cohort study design comes? Prospective or retrospective? Obviously it is prospective. Prospective cohort similar to longitudinal. So that is the same thing. Okay. Then you have cohort, which one? Retrospective. Okay. Retrospective cohort. Then you have RCT. फिर कौन सा होता है? Systematic review. And what is the gold standard of evidence-based medicine? What is the gold standard of evidence-based medicine, everybody? सबसे बढ़िया, सबसे अच्छा study कौन सा है? Meta-analysis. So what is the answer over here? Non-concurrent cohort. Why non-concurrent cohort? Because it is the same as retrospective cohort. Am I clear? The best study design to establish causality, everyone, is meta-analysis. But out of the options that you have got over here, it becomes a non-concurrent cohort or a retrospective cohort. ठीक है? Thumbs up everyone. Who's the father of evidence-based medicine? It is David Sackett. So you have revised everything with the help of an MCQ. Almost the entire EPID we have had gone through. Okay? Alright. Chalo, let us go to the next question now. A person going for self-health checkup to a hospital as his father died last week due to ischemia. So which level of prevention is this? Prevention is again okay, Omar. All right. Okay, we'll try to stick to English. Okay. So a person who's going to health checkup to a hospital as his father died last week due to ischemia. So which level of prevention? A, C. What are you doing? Some are saying primary, some are saying secondary. Guys, any form of health checkup. Why will I go to a hospital? To find out whether I am starting to develop a disease or not. So it is to make an early diagnosis. And when you make an early diagnosis, it is which level of prevention? Secondary. Alright, we will go to a hospital to make an early diagnosis of a disease. Okay, now here the person is scared that his father had died and maybe they shared the same risk factors, and so now he is going to the hospital to see whether the disease has started him in or not. So it is which level of prevention? Secondary level of prevention. So do this, fill in the blanks. Pehla wala, what is this? Prevent the occurrence of risk factors. Which level of prevention? When we have to prevent the occurrence of risk factors. Subhashi's vaccination is primary level of prevention. Why are we vaccinating a child? So that the child does not go on to develop that disease. Okay. So vaccination is primary or specific protection. So when we have to prevent the occurrence of risk factors, it is primordial. What is the mode of intervention? How will you achieve this? You are going to achieve this through what is known as health education. When you have to prevent the occurrence of disease, that means risk factors are already present. So here you will have primary level. This is achieved through health promotion and specific protection. When you have to prevent the occurrence of complications from disease, that means disease has already started. So here it is secondary level of prevention. Okay. via screening modalities, early diagnosis and treatment. And when you have to prevent the occurrence of disability or fatality due to a complication from a disease, this everybody is what? Tertiary level of prevention. So here it is achieved through modalities, which is disability limitation, and what is the other one? Rehabilitation. Okay. All right. What is spectacles an example of? Can anyone tell me spectacles kya hai example of? What is spectacles an example of? Spectacles. So spectacles stabilize. All right. Spectacles stabilize the vision and provide visual clarity. Okay. So what is happening? It is which level of prevention? So that is not a secondary level, that is a tertiary level. Because spectacles is not correcting myopia, it is just stabilizing your vision and providing you visual clarity. So spectacles become which level of prevention? Tertiary level of prevention. Okay, I'll show you one more question. Dekho. Can you do this? If counseling and screening for TB in a treatment nahi hai Pathan, what happens if you wear spectacles? It's only stabilizing my vision. But if you got a LASIK done, LASIK is something which will correct myopia. Okay, LASIK is something which is going to correct myopia. So this is a form of treatment. So LASIK is secondary. Clear? All right. Now what is the answer to this one? Read it carefully. There are two things mentioned over here. None of you are writing it correctly. None of you have marked it correctly so far. Everybody. Counseling and screening. What is it? Counseling is which level of prevention? Very good. Ashi has got it correct. Option E, guys. Counseling is what? Primary level of prevention, and screening is secondary. So I've put both in the option. So your most suited answer here is primary as well as secondary. Counseling is a kind of primary level of prevention. Okay, I will counsel a couple or someone so that they don't go on to develop the disease. So here, and screening over here becomes secondary level of prevention. So the answer becomes primary as well as secondary. Got it, everyone? Okay. Chalo. Let's quickly revise PQLI and HDI. What is the answer to this? True about PQLI. Rabies immunoglobulin. See, rabies immunoglobulin, or if you talk about post-exposure prophylaxis. Just a second, guys. Just a second. Rabies में post-exposure prophylaxis होता है ना? Which level of prevention? बताओ. Rabies, post-exposure prophylaxis, whether it's category 1, 2, 3, I'm not worried about this. I am just saying post-exposure prophylaxis. Which level of prevention will that be in rabies? Now, post-exposure prophylaxis, why are we giving rabies vaccine or immunoglobulins? So that the person does not go on to develop rabies, okay? So, any form of prophylaxis will be always primary. Secondary kab hota? When the person had suffered from rabies. He has not suffered from rabies. We don't want him to go and suffer from rabies. So this is what? Primary or specific protection. ठीक है? All right. We have a question on rabies also. So we will be discussing that. Don't worry. Chalo. So what is the answer over here? Okay, what is the answer? To stop cigarettes and nicotine. Rohit, that means already the people are having the risk factors. They are already smoking. They are already taking nicotine. So risk factor is there. And now you've launched any act or you've launched any guideline. So that becomes primary level of prevention. Okay? All right. So here, very good. Life expectancy at 1 year, IMR and literacy rate. Okay? So what is the answer over here? True about PQLI. So let's do a comparison quickly between PQLI and HDI. So what is PQLI? In this, life expectancy at 1 year. Okay. Now you cannot make out development. So when we have to look out HDI development, we will look at life expectancy at birth. Okay. All right. What is the second one for PQLI, everybody? What is the second one for PQLI? Guys, whatever questions you have, you can ask me towards the end. I can give you then. Okay, let's go ahead. And if you have any more doubts, queries, I'll take it up at the end. Okay, everybody? All right, PQLI में what is it? Literacy rate. Okay, literacy rate. But in HDI, we now have what is known as education index, or you also call it as knowledge index. Okay, knowledge index. In this you have two things: expected years of schooling plus mean years of schooling divided by 2. Now this is 1 year, so this becomes infant mortality rate. Now can you expect development without taking into account income? No. So here what is the next one? Per capita income. Okay, per capita income. What is the scoring of PQLI, guys? PQLI की scoring होती है 0 to 100, HDI की scoring होती है 0 to 1. ठीक है? And what is the current value of HDI? Now it is 0.633 and India is ranking 132. India is ranked now 132. Alright? Primordial, don't start smoking and drinking. That is primordial. Don't start with that risk factor. Okay? Don't start smoking and drinking. वो तुम्हारा primordial हो जाता है. ठीक है? Okay, so clear about PQLI and HDI, everyone. ठीक है? Can we go to the next one? All right. So in the following figure, which point is critical time of diagnosis? बताओ. कौन सा point critical time of diagnosis है? One of the most expected images in exam. Critical point of diagnosis बताओ इसमें क्या है? Which is the critical point of diagnosis? A, B, X or Y? Very good. A is what? A is the first possible point of diagnosis. Sorry. A is the disease onset, okay? B is the first possible point of diagnosis. First possible point means there are no signs and symptoms. Can you identify a disease when there are no signs and symptoms? Yes, by the technique of screening. What is X? X is the critical point, okay? If you want to get the benefit of a screening test, please apply it till point X, okay? And what is Y? Y is the usual time of diagnosis. Usual time of diagnosis means that the person is going to present with what? Signs and symptoms. तभी वो आएगा डॉक्टर के पास. So can we identify the person before he has signs and symptoms? Yes. So instead of applying a test at point Y, let us apply at point B when he has no signs and symptoms. So what is the lead time, guys? B to Y. This also comes in your exam. B to Y is the lead time. Got it, everyone? So instead of applying a test at point Y when he is presenting with signs and symptoms, let's apply it at a point B. So the time that you are gaining is the lead time. तो critical point मैंने पूछा था, so critical point is X. बहुत famous question है. Don't mess it up, okay? And here screening becomes which level of prevention? Secondary level of prevention, okay? Understood? Can I go to the next question, everybody? Now I'll tell you an easier way to remember the formulas also, okay? Okay, try out this. Out of 1,000 population, a screening test found 90 to be diabetic correctly. Then a gold standard test found 100 to be diabetic. What is the sensitivity of the test? Do you need to make a 2 by 2 table here? Do you need to make a 2 by 2 table here? या ऐसे ही बता सकते हैं. बनाओगे 2 by 2 table here? ज़रूरी है 2 by 2 table यहाँ पे बनाना. There is a screening test which is found 90 to be diabetic. ठीक है? Gold standard बोलता है 100 diabetic है. That means what is sensitivity? Ability of a screening test to identify all those who have the disease, right? All those who have the disease. So gold standard is telling me that 100 have the disease. And screening test is telling me 90 have the disease. So what is sensitivity? 90 by 100. Clear? You don't have to make any 2 by 2 table over here. The gold standard tells me that 100 are diabetic and screening test is identifying it correctly in 90. So what does the sensitivity becomes? 90 by 100. Got it, everyone? So if you've understood, fill in the blanks. What is this? Ability of a screening test to identify all those who have the disease. Can you fill in the blanks for me? Ability of a screening test to identify all those who have the disease. This is nothing but sensitivity. Okay. What is the next one? Ability of a screening test to identify all those who do not have the disease. This is specificity. You can get simple question like this also. In fact, they have come before. Ability of a screening test to identify correctly all those who have the disease is sensitivity. All those who do not have the disease is specificity. ठीक है? अब next वाला देखो. Out of all those tested positive on a screening test, like I have come out positive on a screening test. Do I actually have the disease or not? This is given by what? Positive predictive value. ठीक है? Look at the next one. Out of all those tested negative on a screening test, how many actually do not have the disease? I have come negative on a screening test, but क्या वाकई में मेरे में disease नहीं है? That is what? Negative predictive value. And what is the last one? Ability of a screening test to differentiate diseased from non-diseased. What is this? Ability of a screening test to differentiate diseased from non-diseased. All true positives from all true negatives. What is this, guys? Last one. Tell me the last one. Ability of a screening test to differentiate diseased from non-diseased. That means differentiate true positives from true negatives. So you are using true positives also, true negatives also. No. Very good. I can see Dreamer writing the correct answer. Validity or accuracy. Okay. That is nothing but validity or accuracy. Okay. What is validity or accuracy? The ability of a screening test to differentiate all those who are diseased from all those who are not diseased. And validity or accuracy includes what? It includes sensitivity, which is true positive, and it includes specificity, which is true negative. What is precision? Precision is reliability. Okay, that's a different thing. Findings are repeatable or reliable. वो precision होता है. ठीक है, crazy dog? Okay. Everyone, did you understand? Now, what about the formulas, guys? What about the formulas? So, suppose we'll just quickly do the formula. Disease, yes, no. Screening test, positive, negative. हमेशा याद रखोगे, हमेशा. A, B, C, D. Never write A, B, C, D. That is wrong. Okay? A, B, C, D. So, what is A, everybody? What is A? Disease present, screening test positive. True positive. Right? Disease is not present, but screening test is saying you have the disease. So, what is this? False positive. Now look at this. Now look at this. In the first row, okay, in the first row, you have all positives, okay. Disease is present, but screening test tells you don't have the disease. So C is false negative and D is true negative. So in the second row, you have all as negative. So that's how you can remember. Now what is sensitivity? Ability of a screening test to identify correctly all those who have the disease. So disease is present in TP plus FN, or screening test has identified it in TP. What is specificity? Ability of a screening test to identify correctly all those who do not have the disease. So disease is not present in TN plus FP. Screening test identified it in TN. Very good, Sarika. Now, what is positive predictive value? What have I taught you in the classes? That it's all positives. That means even if I have come positive for a screening test, do I actually have the disease or not? So, how many have come positive for a screening test? TP plus FP. उसमें से कितनों में disease है? TP. So, all positives. And what is negative predictive value? Even if I have come negative on a screening test, how many actually do not have the disease? TN. So, all negatives. Okay, that's how you're going to remember. In PPV, it's all positives. In NPV, it's all negatives. Okay, which is the most useful property of a screening test, guys? The most useful property of a screening test is sensitivity. सबसे अच्छा property screening test का क्या होता है? The most useful property of a screening test is sensitivity. Okay, all right. Now read this question. Due to, and this is one of the very commonly asked topics, okay, due to an effective campaign, program, the prevalence of an infectious disease in a community has been reduced by 90%, okay, all right, because false positives decrease. Subhashish, okay, Bayes theorem is asked in INI-CET, so you don't have to worry about that right now, okay. What is the answer to this? Due to an effective program, the prevalence of an infectious disease in community has been reduced by 90%. A physician continues to use the same diagnostic test. How have the test characteristics changed? Now, this is based on a simple principle, guys. What is that principle on which this question is based? Anybody? Very good. Q, you have to remember positive predictive value. This has been asked many times. It's a very famous PYQ. Okay, positive predictive value is directly proportional to prevalence and negative predictive value is indirectly proportional to prevalence. So here the prevalence has reduced. So when the prevalence will reduce, okay, the prevalence has been reduced. So what is going to increase? The prevalence in this question क्या हो गया है? Prevalence has reduced. So what is going to increase? Negative predictive value, okay. Positive predictive value has decreased over here, because just remember a golden point, since exams are very near, that positive predictive value is directly proportional to prevalence and negative predictive value is indirectly proportional to prevalence. Thumbs up everyone, got it? Clear? Can we move to the next one, everybody? Chale aage. All right. Okay, now one of the most commonly asked topics these days from vaccine. A vaccine campaign has got opened pentavalent and opened MR vaccine. Which is true? Batao, very easy, open vial policy. So you have an open pentavalent also and an open MR vaccine also. कौन सा use करोगे? Okay, so you are writing C, absolutely correct. Why? Open vial policy. What have I taught you? Once the vaccine vial is opened, they can be used up to 28 days provided they are maintained in proper cold chain condition. Okay? Now, what is the mnemonic that we have learnt? Vaccines which follow open vial policy. Batao, vaccines which follow open vial policy. What are the vaccines which follow open vial policy? What is the mnemonic for that? The mnemonic for that is T series vaccine plus PO. Okay, T series vaccine plus PO. PO here matlab we are talking about the liquid vaccines. Okay, so T series means all the vaccines which have letter T in them. Okay, so here it will be hepatitis B. Okay, it's going to be hepatitis B. It is going to be pentavalent. It is going to be TD vaccine. It is going to be DPT vaccine, all which have the letter T in it. P say PCV, I say IPV and OPV. So these are the vaccines which follow open vial policy. And what are the vaccines which do not follow open vial policy, guys? What are the vaccines that do not follow? What are the vaccines that do not follow open vial policy? Can you tell me? So they are what? Reconstituted vaccines. So what are those reconstituted vaccines? We already know BCG, measles, rubella, ठीक है, JE और yellow fever vaccine. Even rotavirus vaccine does not follow open vial policy. Many of you ask this. Rotavirus and rabies. Okay, these vaccine also do not follow open vial policy. ठीक है? So here Just remember the mnemonic that the vaccines that follow open vial policy are T series as well as PO. So what was the question over here? Pentavalent and MR. So MR is reconstituted, discard it and use pentavalent. Okay, very good. Chalo, let us move forward now. A 32-year-old person traveled to Africa. He reported fever followed with chills. Which vaccine, if he had taken before travel, he could not have developed the disease? What is the strain of the vaccine? So again, the strains are very commonly asked in exams. Okay? So batao, he is traveling to Africa. So the vaccine that he must have taken, very good, he would not have developed the disease. What is this? 17D. Why? Because 17D kaun sa hai? Yellow fever vaccine. Gerillin is a strain for which one? Gerillin. ठीक है, Gerillin कौन सा है strain? Gerillin is the strain for which vaccine? Everybody बताओ. Gerillin, come on quickly. Gerillin is the strain for which vaccine? Very good. This is for mumps. Edmonston Zagreb for measles. Okay. And Oka from the letter K. Oka is for chicken pox. Okay. Oka vaccine is for chicken pox. Okay. So this also comes in your exam. Alright, in pulse polio immunization, VVM to maintain cold chain. Which of the following is an indication to discard the vaccine? Vaccine vial monitor में कौन सा इंडिकेशन है वैक्सीन को डिस्कार्ड करने के लिए? सो वी ऑल नो दैट वी हैव एन आउटर सर्कल एंड इनर स्क्वायर, राइट? The earth is round and we are all living inside it. So we have an outer circle and inner square. So when will you discard it? Think carefully, it's not at all difficult. Inner square is darker than the outer circle. Okay, that's when you're going to discard it. So vaccine vial monitor is just a heat sensitive label which is put on the vaccines vials. Okay, so if the inner square is lighter than the outer circle, use. It starts to change color but is still lighter, use. But if it becomes the same color, guys, same color, discard. And if it is darker, you will discard. Clear? Yes, very good. VVM is an example of which principle of primary healthcare? So it is an example of appropriate technology. ठीक है, किसका example है which principle of primary healthcare? Appropriate technology. ठीक है? Okay. All right. Quickly tell me the answer to this. Let's revise our NIS also because there's an update also in our national immunization schedule. You are posted at a PHC. You have to ensure routine vaccination process. All of the following are given at 16 to 24 months except. What is your answer to this? Okay, so at 16 to 24 months, what is all of the vaccines are given at 16 to 20? Is it C or is it D? PCV booster is given at 9 completed months. Okay, so let us quickly revise the immunization schedule. What are the vaccines which are given at birth, guys? We give BCG, OPV 0 and also we give hepatitis B. 6, 10, 14 weeks. Just write all the vaccines that can be given at 6, 10 and 14 weeks. Okay. So what all vaccines can you give at 6, 10 and 14 weeks? OPV 1, OPV 2, OPV 3. Similarly, rotavirus 1, rotavirus 2, rotavirus 3. और क्या दे सकते हो आप? Penta 1, alright, Penta 1, Penta 2 and also we are giving Penta 3. Then what are we giving? We are also giving now fractional IPV 1, fractional IPV 2, PCV 1, PCV 2 and 9 completed months, guys. What do we give at 9 completed months? Measles rubella का पहला dose, Japanese encephalitis का पहला dose and what is the update? What is the update, guys? That now we are also giving fractional IPV 3 at 9 completed months. Plus PCV booster. ठीक है? Every 6 months from 9 months onwards till 5 years, what are we giving? Vitamin A. Update मत भूलना, fractional IPV third dose at 9 completed months is being given. ठीक है? चलो, very good. 16 to 24 months is the time for measles rubella second dose, JE second dose, and OPV booster, and which one? DPT ka first booster. 5 to 6 years we are giving what? DPT ka second booster. 10 and 16 years TD1 and TD2. Clear everyone? Will you remember this? The update is fractional IPV third dose has now been added at 9 completed months as well. Okay? Alright. Now let's do this one. This is a question from delayed immunization. Okay? So tell me, a mother with his 6 months old child presented to the hospital with concern that the baby missed his vaccination. Which of the following statement is false? Just tell me each one of it. Okay. Direct BCG can be given till 1 year. True, false? बताओ. True है या false है? Direct BCG can be given till 1 year. Just first let's look at all the individual statements. Okay, tell me the first one. Direct BCG can be given till 1 year. Very good. True. Direct means you don't need to perform a tuberculin test. Okay. OPV 0 dose vaccine can be given within first 15 days. Absolutely true. The birth dose of OPV है ना, can be given till 15 days. Hepatitis B birth dose can be given within 24 hours. Is it true or it is false? Birth dose of hepatitis B दे सकते हो 24 hours में? हाँ जी, दे सकते हैं. Pentavalent vaccine till 5 years. बताओ. Pentavalent vaccine till 5 years. Is it true or is it false? Pentavalent. Which one are you answering? Pentavalent. False. Pentavalent vaccine can be given till 1 year, everybody. Okay, so that was the answer. Rotavirus till 12 months. Absolutely true. Pentavalent till 1 year. Okay, now here I want to tell you an update, guys. सुन लो, अच्छे से सुनो, ध्यान से सुनो. There's an update, guys. Okay, when you talk about this. Now, you know, we just discussed an update that fractional IPV3 can be given at 9 months. So, earlier IPV was being given till 1 year. But now, if a child misses IPV dose, IPV can also be given till 16 to 24 months in case of delayed immunization. Will you remember this, everybody? Yes or no? Chale? Did you understand? 1 second. Okay, yes, Neelam, any problem, dear? ठीक है. Fractional IPV can also now be given till which year? Fractional till what time? 16 to 24 months also. Otherwise IPV was being given till 1 year, but now it can also be given till 16 to 24 months. याद रहेगा सबको? ठीक है. Okay, DPT vaccine can be given till how many years? DPT vaccine can be given till 7 years. What about JE vaccine? No, see, fractional IPV in the sense, Dark Knight, that suppose the child did not receive even one vaccine of IPV, okay? So he can get it till 16 to 24 months. ठीक है? All right. Japanese encephalitis till 15 years. Japanese encephalitis till 15 years. ठीक है? Alright, going to the next question. Now we are going to focus on all the back chapters. ठीक है? जो पीछे वाले chapters नहीं है, disaster, planning, all those things we're going to have a look in another half an hour. Okay? Alright. Chalo, so tell me the answer to this. Sociology is the study of human relationships and human behavior. Internship training program of doctors is an example. Rotavirus till 1 year. ठीक है? Answer do. What is this? Internship training program of doctors. Is it acculturation? Is it pathology? Is it culture? Is it socialization? Just think a little bit. Why are we having internship training? So that we get familiar to the process. Okay. So it is an example of socialization. How we adopt the culture and make it a part of our own. Okay. Internship training is an example of socialization. Social acculturation is cultural contact. Okay, it is cultural contact which happens during things like marriage or like conquest, or you have gone to study in a country, ठीक है, trade and commerce, all that. Okay, everybody, this is socialization. What is culture? Is learned pattern of behavior. What is culture, everybody? Learned pattern of behavior is culture. What is established pattern of behavior known as? Established pattern of behavior किसको बोलते हैं? Established pattern of behavior. So established pattern of behavior is custom. ठीक है, learned pattern of behavior is culture, established pattern of behavior is custom. Okay, all right. What is social pathology? Social causes which can lead to the occurrence of a disease. That is what is social pathology. ठीक है, all right. Let us have a look at a few more things. Okay, if I ask you what are the types of learning, can you quickly tell me the types of learning, guys? One is cognitive learning, one is affective learning, and one is what? Psychomotor learning. What is psychomotor learning? Psychomotor learning क्या होता है? When we are trying to develop the skills of a person. Okay, like training an intern for knee reflex demonstration, or training a child in hand washing techniques. Okay, so that is what is psychomotor, which can come in your exams. All right, next question. Now this is the last year PYQ. I just wanted to revise some points from contraceptives now. ठीक है, I'll tell you all the important things that can turn up. बताओ, non-contraceptive benefits of combined OCPs to a woman are all except. This is the last time PYQ. What is your answer? Don't make a mistake in contraceptives, one of the most expected topics. So we'll be looking at some of the questions from that. I'll show you the entire list. Very good. OCPs don't protect against cervical cancer. Okay, so just have a look at this list. Non-contraceptive benefits, very, 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 very important. ठीक है, non-contraceptive benefits of OCP. Read with me. Number one, benign breast disorders. Okay, ovarian cysts, benign breast disorders, ovarian cysts, iron deficiency anemia, obviously it has iron tablets, osteoporosis, PID में भी help करता है, ectopic pregnancy, ovarian cancers, endometrial cancers, and I'm sure you've learned from OBG, it is used in DUB, dysfunctional uterine bleeding, irregular menses, as well as dysmenorrhea. ठीक है, so these are the non-contraceptive benefits. But question क्या था? It is not protecting against cervical cancer. ठीक है, another question. So this time, last time they gave you non-contraceptive benefits. This time they can give you absolute contraindication. Yes, some research has shown, Binji, that it can. Okay, there is an ongoing research on that. So from the 4 options, the best was it never protects from cervical cancer. ठीक है, ये बताओ absolute contraindications of OCPs. 2 topics that you must revise. Absolute contraindications of OCP and IUDs. PID में you should never put intrauterine devices. Okay. So what are the absolute contraindication of OCP? What is your answer? C and D. I didn't understand. What are you writing? Okay, थोड़ा सा वो हो गया. All right, let's straight away go to the list over here. ठीक है, look at this list. Can you see absolute and relative contraindication of OCPs? Everybody, ध्यान से देखो. Absolute contraindication, breast cancer. It's protecting from benign breast disease. Okay. Absolute contraindication, breast cancer, genital cancer, liver disease. We are just going through the list once. History of thromboembolism, cardiac abnormalities, congenital hyperlipidemia, undiagnosed uterine bleeding, and pregnancy. Okay, all right. What about the relative contraindication? Very important. If the age is more than 40 years, it's relative. If it's 35 years and she is a smoker, okay, that's a relative. Mild hypertension. Now, absolute contraindication was liver disease. Relative contraindication is renal disease. This is your PARC table, okay. So, in case anybody wants to know, Epilepsy is a relative contraindication. Migraine is a relative contraindications. What is the best thing you will advise to a nursing mother? Which is the contraception of choice for a nursing mother? Everybody बताओ, nursing mother में OCP दोगे? कभी भी नहीं देना है, ठीक है? So in a nursing mother, one of the best things that you can advise her is a intrauterine device. More important than a progesterone only pill? No. More important than progesterone only pill, you can ask her to put a IUD. Why do you want to put her on any of the hormones? No. IUCDs, okay? In this time, in this thing, we can put her on IUCDs. Obviously, you can put Antra, you can give progesterone only pill, but the best one over here in a postpartum period, we can advise the women to put an IUCD, okay? That is one of the times she is most receptive to it, guys. She will agree instead of putting her on any of the pills, okay? What about this one, contraindication of copper T? So let's talk about second generation Yashoda, okay? All right. Contraindication of copper T. So you can get contraindication of OCPs. You can also get contraindication of copper T. Batao. Menstruation. Do you put copper Ts during menstrual cycles? Of course, that's the best time, okay? Best time to put an IUCD is during the menses or first 5 to 10 days of menstrual cycle. After delivery, she is most receptive. आराम से लगा दो contraceptive IUCD. After condom rupture, yes, emergency contraception. So IUCD is the best emergency contraception. Yes or no? It's the best emergency contraception. Post molar evacuation, no. We are not talking about that. So what are the contraindications of IUCDs? Can you see over here? IUDs के absolute contraindication is suspected pregnancy. इधर तुम्हारा anemia. Current PID. Never put a contraceptive in a woman who suffers from PID. Okay, never, because it is going to increase its risk. History of PID since last pregnancy is relative. यहाँ पे है on the absolute it is vaginal bleeding. On relative it is purulent cervical discharge. Absolute में what do you see? Cancer of the cervix, uterus, adenoma. On relative side it's not cancers, it's congenital malformations like fibroids and all that. Previous ectopic pregnancy according to your textbook of PARC is an absolute contraindication, guys, okay? Previous ectopic pregnancy. Unmotivated person is relative. Motivation का क्या करना है in an IUCD? Why do you have to be so bothered about motivation? Because the woman has to feel for the thread, everybody, okay? Otherwise it might, you know, it can lead to uterus, it can just disappear. There could be spontaneous expulsion also, or it can go disappear somewhere in the body. Alright, so that is very, very important. Contraindications of IUDs as well as contraindication of OCP, guys. Okay? Okay. One thing I want to ask over here, your National Family Welfare Program is providing which copper T under the program? Remember, it is copper T 380A. Okay? That is what the National Family Welfare Program provides. From the barrier contraceptive, ये आ सकता है, इसका क्या नाम है? What is the content present in the given contraceptive image? What is this? This is today. So today is what? It's written also over here, non-oxynol 9. But what is today? Today is the other name for vaginal sponge. Okay? And what happens with this? What happens, I mean, this is also seen in vaginal sponge, okay? What happens, what is the biggest problem? That vaginal sponge, okay, should be left 6 hours after ejaculation, but you cannot forget to take it out. If you forget to take it out beyond 24 hours, it will lead to what? DIC. ठीक है, toxic shock syndrome, the woman can die. So the question can come, a contraceptive was put and a woman reportedly died. What could be the reason for that? Vaginal sponge. Similarly, you have diaphragm also. Both the things can do the same thing. Okay, now tell me the answer to this. After 6 weeks delivery, a P1L1 female desires contraception for at least 3 years. अब delivery हो गए, 6 weeks हो गए. Which contraceptive? So we have just discussed it now. delivery has happened. So which contraceptive does she want? Will you want? But she wants for at least 3 years. So like I said, instead of putting her on any hormone, go and put a copper T. Why not a condom? Because condom has more failure rate when it comes to when it's compared with the copper T. Okay, condom ka failure rate zyada hai. She needs contraception for at least 3 years. So every time using a condom, instead of this, put a copper T. All right, couples living or couples meeting occasionally. Batao quickly, contraception of choice. Couples meeting occasionally. What is your contraception of choice, everybody? Someone has gone to do residency in one city and someone is doing residency in another city. तो कौन सा contraceptive बोलोगे? Meeting occasionally. Which one will you say? Guys, please, according to public health, we will say a barrier method. Okay, a condom. They are meeting occasionally. Why do you want to put a thread or something? Why do you want to put an IUD or something? The woman is not having sexual intercourse. How will she remember to feel for the thread? Okay, all right. So barrier method is the good for couples meeting occasionally. Newly married couple के बारे में बताओ. Newly married couple. If the woman has no problem as such, then newly married couple के लिए which is the best measure? Which is the best contraceptive, guys, for newly married couples? Everybody, can you tell me for newly married couples? If you don't have any problem, if the woman does not have any problem, OCPs. What is the best contraception for adolescents? Batao, adolescents. What is the best contraception of choice for adolescents? We have reported adolescent pregnancy, teenage pregnancy, all these are becoming very common. So adolescents के लिए, again, you can't put them on a pill, you can't put them on an IUCD or anything. So again, barrier method, it is condoms. ठीक है, याद रहेगा सबको all these golden points. Okay, all right. Now a quick look at some of the questions from biostats. Okay, चलो, answer. I hope I'm not going too fast. Okay, I'll take up your doubts towards the end. Don't put any adolescent on a pill or anything. The best thing for an adolescent is let the adolescent use a barrier method, condoms. ठीक है? Within 6 weeks of delivery, intercourse is not recommended. Okay, after 42 days only intercourse is recommended. ठीक है, dark night. Okay, and actually क्या होता है ना कि instead of putting on a pill, the best time, the receptive time is जब placenta निकलता है या when delivery happens, within 48 hours you put an IUCD. Okay, that's one of the best things that can be done. Okay, POP is again best in an elderly woman, all right, MA, or after delivery, after 6 weeks of delivery. But then when you have in the option IUCD also, put that instead of putting her on a hormone. ठीक है? Okay, chalo. That's very nice, Tibayan. What is your answer to this? Wide range of values reported in a community is measured by, guys, wide range of values. Wide range of values. What are we talking about here? Just a different way of asking. No. Wide range. Wide range. Q DJ? BQ answer bol rahe ho? Why, Naveed? I want the answer. Why you saying median? Wide range of values means outliers. And when outliers are present in your data set, it makes your data skewed. And when you have a skewed data set, what will you use? What is the best measure of central tendency in a skewed data set? What is the best measure of central tendency for skewed observation, everybody? Median. Yes or no? Wide range of values matlab extremely high or extremely low. Okay, too high or too low. So they are what? They are outliers. And when you have outliers in your data set, median is the best measure of central tendency. Now I'll give you one example. Okay, look at this data set. 10, 12, 14, 20, 25, 26. Which measure of central tendency would you like to use over here? 10, 12, 14, 20, 25, 26. Do you see any outliers over here? कोई outlier दिख रहा है तुम्हें? Do you see any high value or low value? No. So, we will use mean because that is the best measure. It includes all the observations. But in case you got a question, 150, 300, 200, 5000, okay, 560, 600. Now, for this data set, which measure of central tendency would you use? Mean, median या mode? बताओ, look at this data. 150, 300, 200, 5000, 560 or 600. Which measure of central tendency would you use? Why? Why median? Because this is an extremely high value. So this becomes an outlier. When you have an extremely high value, an outlier, it becomes skewed. So for skewed, the best measure of central tendency is median. Okay, so whenever outliers are present, the best measure of central tendency becomes median. Okay, all right, chalo. Now tell me the answer to this. All are true regarding Gaussian distribution except Gaussian distribution can come in your exam. It means normal distribution. So what is the answer to this? Try to rule out your options here, guys. Try to rule out your options. Options ko rule out karo. Bilaterally symmetrical and bell-shaped curve. Of course. Can you see this? This is bilaterally symmetrical and bell-shaped curve. Yes. At this POC, at this point of coincidence, mean, median, mode, all coincide. So suppose it is equal to 0. 50% observation is above and 50% is below. So what is the total standard deviation, guys? Total standard deviation is 1. So correct representation for normal distribution, mean is equal to 0, standard deviation is equal to 1. So what is the area under the curve? 0.5 plus 0.5, so that will be equal to 1. वो भी तो correct है. Non-parametric tests are used to find statistical significance for a normal distribution. No. For a normal distribution, we will always use parametric test, not a non-parametric test. For skewed distribution, non-parametric test skewed distribution के लिए होता है. ठीक है? Plus इसमें एक question आता है. Mean plus minus 1 SD covers what percent of observation? Tell me. Mean plus minus 2 SD covers what percent of observation? Mean plus minus 3 SD covers what percent of observation? Can you fill in the blanks? These are all PYQ. Mean plus minus 1 SD, 68%. Very good. Mean plus minus 2 SD, 95%. Very good. 3 SD, 99% observation. Okay? So don't forget these golden points. We are just revising. If you forget the point values, that's okay. Okay? Or mean plus minus 1.64 SD covers 90%. This was once asked in an AIMS paper. What if they repeated? So you should know it. Okay? Now look at this diagram. What is this type of distribution? What is this type of distribution, everybody here? Can you tell me the type of distribution over here? ये कौन सा distribution है? I think it's a little light. The direction of the tail is going towards the left side. Okay, so negatively skewed. All right, look at the direction of the tail. It's going towards the left side. So negatively skewed, everybody. And for negatively skewed, mean is always less than median is less than mode. Okay. And what about positively skewed? The direction of the tail will always be towards the right side. So mean will be more than median, will be more than mode. Okay. All right. Chalo. Let's see how many of you can answer this. Take your time and tell me what it is. Then I'll show you some graphs. So a lecturer states that the correlation coefficient between prefrontal blood flow under cognitive load and the severity of psychotic symptoms in schizophrenic patient is minus 1.24. ठीक है? ये value आया है. What do you want to say about it? Read the options and tell me. correlation coefficient. Correlation coefficient is given by small letter r. So that has been reported as minus 1.24. Is it correct, or is it like what is it telling me? Anyone? Okay, some of you are saying B, some of you are saying obviously. Very good, guys. Correlation coefficient is given by scatter diagram. Yes, and the value of correlation coefficient is given by small r. है ना? The value of this ranges from -1 to 0 to +1. Can it ever be minus 0.24? Nahi. That means the lecturer has reported it incorrectly. It can never be -1 से नीचे, or it can never be +1 से ऊपर. So that means -1 means -1 is this. Okay, all the dots are here. So this is -1. This is no association. Okay, and this one over here like this, all the dots here is +1. So this is perfectly negative, perfectly positive, no association. So not A Ashi, not A Neelam, क्योंकि correlation coefficient ranges from -1 to 0 to +1. So it can never take up the value of -1.24. Is it clear? Everybody, did you understand this conceptual question from scatter diagram, guys? Okay, so they can trick you like this. Please don't get tricked in your exams. Chalo, some image. What is this? Just name the name of this image quickly. What is the name of this image? You are representing height. So that means this is what? This is a histogram, all right, where we are representing what? Frequency of which variable? Frequency of continuous variable, okay. So frequency of continuous variables के लिए we have what? Histogram, okay. There is no gap over here. Which is this image? Look at the first image over here. Favorite type of movie. अगर ये image आया, so this is frequency of qualitative variable. Frequency of discrete variable. So what is this, everybody? When you represent frequency of discrete, this is a simple bar. ठीक है, ये क्या है? Simple bar diagram है. What is this? This is a multiple bar diagram. And which one is this one? Component bar. It can definitely turn up in your exams. Remember, bar diagrams are for discrete variables, okay, and histograms are for continuous variables, okay. Next, can you just label this? This one we know is a scatter diagram. Quantitative data representation, okay. What is this? It is showing a rise fall like this. So this one, guys, is a line diagram, okay. ये क्या है? Line diagram. Whenever you have to represent the trend of a disease, okay, trend of a disease, or I could say incidence of a disease, we will use a what? A line diagram. ठीक है, किसी भी केस का डिजीज का इंसिडेंस वी वांट टू रिप्रेजेंट, यूज दिस. इफ द केस इज कंटिन्यूअसली इंक्रीजिंग, वी विल यूज क्यूमुलेटिव फ्रीक्वेंसी कर्व, ओके. इफ द केसेस आर शोइंग अ continuous increase. What is this? Something which has been drawn above an histogram by straight lines. So we are drawing by straight lines. What is this, guys? This is nothing but frequency polygon. All of these are quantitative method of data representation or qualitative method. ये जितने आप देख रहे हो ना, scatter diagram, line diagram, cumulative frequency curve, frequency polygon, they are all quantitative methods, okay. All right, one more thing which can come from biostats is your test of statistical significance. So this is one topic we are going to look in biostats. Can you quickly tell me the answer to this? Can you quickly tell me the answer to this? A study was undertaken to assess malnutrition among young children. A sample of 100 children. Okay, so how will you approach this? Okay. All right, how are you going to approach this? How are you going to approach a question like... Please try again. What is happening? Okay, how are you going to... Alright, how are you going to approach this question, guys? First of all, look at what are you comparing. Are you comparing a quantitative variable or are you comparing a qualitative variable? So here मैं क्या compare कर रही हूँ? I have to see malnourished. Okay, so malnourished, yes, no. And I can see in rural areas or urban areas. ठीक है? Now malnourishment status is quantitative or qualitative? Of course it is qualitative. Yes, I will express malnourishment in terms of percentage and proportions, that 20% or 10% are malnourished. Okay, so whenever you compare percentages and proportion, you will use which one? A non-parametric test. Paired, ANOVA, these are all parametric tests. Okay, so we won't use them. 2 by 2 mein we will use chi-square test. Okay, so what you have to remember, guys, for parametric we will use what? Quantitative variables. Non-parametric के लिए कौन सा ये होता है? What do we use? What do we compare? Qualitative variables. So here we are comparing what? We compare percentage and proportions. ठीक है? In parametric we compare means and SDs. Parametric is always for normal distribution. Non-parametric for skewed distribution. ठीक है? Parametric is more powerful, non-parametric is less powerful. ठीक है? Now how can you remember the types of parametric test, guys? Always remember alphabets. ठीक है? Parametric is denoted by alphabets. So what are the alphabets that you have over here? T-test, ANOVA and Z-test. Okay, so when you have T-test, okay, if you have a T-test, okay, T-test could be paired or unpaired. Paired means for a single group, unpaired means for two groups. ANOVA means for more than two groups. And non-parametric mein we have all fancy names. The most commonly used non-parametric test, everybody, is chi-square test, which will come as an interpretation. So look at this. Can you tell me which one are you going to use over here? Compare hemoglobin in a group of alcoholics before and after treatment. क्या use करोगे if I ask you compare hemoglobin in a group of alcoholics before and after treatment? Can you quickly tell me? Compare hemoglobin in a group of alcoholics before and after treatment. Which one are you going to use? So you are in a group of alcoholics, Gulshan. Are you doing it in one group or are you doing it in two groups? In a single group of alcoholics, we are comparing hemoglobin. So this one will become a paired T-test. Very good. Compare obesity in a group of women before and after dietary regimen. So you are comparing obesity. Now obesity in itself is a qualitative variable. So here you can definitely use a chi-square test, okay, or a non-parametric test. Group of 20 females, obesity is not quantitative, it is qualitative. Either you are obese or you are not obese, okay? Group of 20 females, compare weight. 10 receive dietary supplements, 10 receive exercise. इसमें बताओ. So we had a group of 20 females, इसको मैंने 10 और 10 में divide कर दिया. So 10 receive dietary supplements, 10 receive exercise. So now you are comparing weights. Weight is quantitative and you are comparing in two groups. So what will it become? Unpaired T-test. Okay, so all you need to do, guys, is सबसे पहले देखना, are you comparing quantitative, qualitative? Then you see, are you doing it for one group, two group, more than two groups? Parametric tests are all alphabets, okay? Non-parametric tests, everybody, are all the ones with fancy names, okay? All right, another question. Sorry. Can you tell me can anyone tell me the answer to this question? Now let us talk about, देखो, sign test or Wilcoxon sign rank test or Mann-Whitney U test, okay, you would not be asked the interpretation. Wilcoxon sign rank test is for a single group. Okay, McNemar is for a single group. Okay, but in NEET PG we have seen that the interpretation is being asked for chi-square and t-test. Okay, ठीक है, somebody asked me, student t-test is same as unpaired. नहीं, MA, एक second guys, student t-test, okay, this could be either paired or unpaired. Okay, student was a person who found out, and unpaired is also known as independent t-test. Okay, unpaired is also known as independent t-test. Clear? कभी ये मत सोचना that t-test is only paired or paired ही है या unpaired ही है, नहीं, it can be both paired as well as unpaired. Now what is the answer to this? In European country, birth rate is below death rate with no population addition. What does this increase? So now what has happened? CBR has become less than CDR. What is the answer? Very good, declining. You can get any of the phases. Okay, birth rate has become less than death rate, so the population is declining. Obviously तुमको कोई भी phase exam में आ सकता है. So let us quickly revise this. This is what? Demography transition model. Okay, this is what? Demography transition model. Now what happens in first phase? What happens in first phase? So both CBR and CDR are high. So population is stable. इसको क्या बोलते हैं? First phase is known as high stationary, right? The first phase is known as high stationary. Then hospital services start to develop. So CDR starts to decline. But what happens to CBR? It is still high. Okay, as you can see over here. So this is which phase? Early expanding. Okay, population is growing at a faster rate. Then what happens in phase 3? CDR continues to decline, everybody, continues to decline. Alright, and CBR starts to decline. So India is currently in this phase. इसको क्या बोलते हैं? Late expanding phase. Alright, then finally CDR and CBR both become low. So population is stable, this is low stationary. And in 5 क्या हो जाता है? CBR less than CDR. India is in stage 3 only. Okay, please remember, India is in stage 3. We are in the late expanding phase right now. Okay. Alright, so you could be asked any of the phases. Please don't get messed up. It could definitely come in your exams, the demography transition model. Okay, chalo. Alright, let us go to the next one. What happened? Yeah. Classify the type of wound. Demographic trap, everybody, is... okay, 1 second. Demographic trap... कौन सा स्टेज है? Since most of you are asking, let me put it down for you. What is demography trap? Country फंस गई है. किस स्टेज में फंस गई है? The country has got stuck in stage 2. None of the country wants to be in this stage. Okay, it's stage 2. All the country want to achieve low stationary, not even declining. ठीक है? So demography trap is stage 2. We don't want to get caught in this phase. Okay, now classify the type of wound. So let us do, this is which type of, like a person has suffered a dog bite. ये कौन सा type of wound है? So we will be talking about rabies management, most expected. ये कौन सा type of wound है? Category 1, 2 or 3? Anybody else? Okay, Purbi is saying 3, Dreamer is saying 3. Here you can see blood, guys. Whenever you see blood, it is category 3 bite. Whenever you see blood, okay, if you see blood, it is category 3 bite. It is not category 1 or it is not category 2. Okay, जब भी आपको blood दिखेगा, category 3 है. So just look at this categories of contact. Okay, category 1, touching of feeding animal, licks on intact skin, कुछ नहीं करना है. Category 2 is nibbling, minor scratches or abrasion but no bleeding. Then only immediate vaccination, local treatment. But even if there is a single bite, multiple bites, bleeding, Licks on broken skin, okay, licks on intact skin was category 1. But agar skin toot gaya and there is a lick on broken skin is category 3. So in that case, all the 3 things have to be done, okay, vaccination, local treatment, rabies immunoglobulin, okay, everyone, even if there is 1 drop of blood. Can you tell me local treatment should be done for kitna, how many, for what time local treatment has to be done? So take the wound under running water and soap for at least 15 to 20 minutes. ठीक है? Now एक question देखो, आंसर करो इसको. A 10-year-old child with unprovoked, okay, sorry, unprovoked, all right, unprovoked dog bites 15 to 20 minutes तक तो करना ही है, all right. A 10-year-old child with unprovoked dog bite comes to you. He has suffered a deep wound. What will you do? Anybody can answer this. Then I'll quickly be telling you about the regimens also. So what are you going to do over here? Okay, Dark Knight says A and C. Caffeine says D. ऐसे लिखो ना. पहला वाला करोगे. लोग first of all unprovoked dog bite, deep wound. So it is category 3 everybody. Will you do a local treatment for 15 minutes? Tick. Will you withhold vaccine and observe the dog for 10 days? No. Give cell culture vaccine? Yes. Kill the dog and send brain for biopsy? That is not required. Immediate. Okay, what will you do? Immediate suturing of the wound will you do? Immediate suturing of the wound? No. Suturing has to be avoided, guys, up to 24 to 48 hours. Okay? So what are the regimens currently we are using? Please remember, हम लोग program में कौन सा regimen use करते हैं? See, even if you are observing the dog and the dog remains healthy, you will continue with the vaccination. Okay? You will never stop the vaccine. Suturing can be done after 48 hours. Okay? Now, one point over here that I want all of you to tell me, that we are using which regimen? Thai Red Cross. ठीक है, कैसे याद रखोगे? I for India. Okay, D for intradermal. And what is this? This has 4 letters. So we will prefer which one? 4 visits. Okay. So when are the visits happening? Day 0, 3, 7, 28. Not on the 14th day. 2, 2, 2, 2. This is on 2 sides everybody. Okay. It has 4 letters. So 4 visits. What is the other regimen that we are advising under this everybody? दूसरा कौन सा regimen होता है जो हम इसके अंदर advise करते हैं? Can you tell me? There is one regimen more which you should know. SN. SN regimen is which one? Intramuscular. So now here this is 5 letters. So how many visits, guys? 5 visits. ठीक है, 5 visits. So it is on day 0, 3, 7 and 14. All right. And which day? Not 21. 21 is for pre-exposure. 28. This is 1, 1, 1, 1, 1. But which regimen are we preferring in our schedule? We prefer intradermal. And suppose everybody there happens a re-exposure. Okay, re-exposure means that if you get bit within 3 months again, then nothing has to be done. But if you get bit beyond 3 months, okay, then only re में कितने letters हैं? 2 letters हैं, है ना? तो अगर 2 letters हैं तो only 2 visits, day 0 and day 3. And you can use intradermal or IM regimen. Please remember this, okay? And once immunoglobulin is given, you do not need to give it any time again, okay? You do not need to give immunoglobulins again. Okay, but what about vaccinating in the dogs? Anybody? Oh, sorry. What about vaccination in the dogs, guys? Can you answer this? This came last time in your NEET PG exams. An urban area has higher number of rabies case. Most cost-effective and logical approach of controlling rabies. Remove stray dogs and vaccinate, build cooperation, test all dogs for rabies, capacity building. So what is the answer over here? Very good. Vaccinate the dog population. We can vaccinate, if you vaccinate at least 80% to 90% of dog population, rabies can be, you can control the infection over there. Okay, so just look at this line. 80 to 90% of dog population is accessible, which confirms the concept of controlling rabies through mass vaccination. This is very important. Okay, 80 to 90% dog population accessible. Good. Okay. Chalo, next one. Let's quickly look at some of the life cycles, guys. Let's quickly look at some of the human immunoglobulin is the one which is preferred over equine immunoglobulin. Okay. All right. And immunoglobulins are given in the wound, around the wound, and whatever is left will be given in some distant area. ठीक है, but immunoglobulin को आप कब तक दे सकते हो? You can give it up to 7 days also. Beyond that, it's not required. All are true regarding JE disease except man acts as reservoir, vector is Culex, pig vaccination controls treatment, and none is true. What is the answer over here? Very good. Man is a reservoir. No, man is an accidental or dead-end host. So look at this. This is your Japanese encephalitis cycle, everybody. Okay, so what is the reservoir over here? The reservoir which can come in your exams. Okay, the reservoirs over here is your ardide birds. Can you see this with the long neck? ठीक है, so reservoir कौन है? ardide birds है, or you can also call it as the water birds. ठीक है, what is the amplifier host, everybody? Amplifier host is the pig. Okay, what is the dead end host? Dead end host is man. And what is what about one more thing? What about cattles and buffaloes? Cattles and buffaloes क्या है? What are cattles and buffaloes, guys? So cattles and buffaloes, everybody, are mosquito attractants. Okay, cattles and buffaloes are mosquito attractants. What is the vector? It is Culex. Okay, vector is Culex. Strain is SA1414-2, yes. And last but not the least, which is that animal which is going to manifest symptoms, guys? So it's only horses. Horses ही सिर्फ एक animal है जो manifest करता है symptoms. Vaccine of course is SA1414-2. Okay, vaccine is SA1414-2. Is this a live vaccine or a killed vaccine? This is a live vaccine. So Japanese encephalitis has come many times. You could also be asked the CFR, guys. Case fatality rate roughly of Japanese encephalitis is how many days? It is 30%. ठीक है, चलो. Which life cycle is this one? Can you see over here which life cycle is this? Tell me. Here you can see a bat, you can see a chimpanzee, you can see a man. Which life cycle is this one? Which life cycle is this one, everybody? Bolo? Not Nipah, not Nipah. Nipah will have fruit bats. This is absolutely not Nipah. What is this? A bat, a non-human primate, and this. No, this is Ebola. Okay, but look at this one. Now tell me, what is this? None of you wrote it correctly. What is this one? This one over here is a fruit bat, a pig, and man. This is Nipah. Nipah is a bioterrorism agent category C. Okay, emerging infection. Ebola is a bioterrorism agent category A. ठीक है? All right. Which life cycle is this? This can come in your exam. This we all know is leptospirosis. Okay, this is what? This is leptospirosis. Leptospira interrogans is released in the urine of the rodents, and if you go swimming, rafting, you can get this infection of leptospirosis. Okay, which one is this one? Can you tell me which one is this, everybody? ये कौन सा है? बताओ which life cycle is this one if you see. So here this is for scrub typhus. Okay, this is for scrub typhus. This is what? Trombiculid mite. Okay, this has come in NEET PG many times. Okay, trombiculid mite. Okay, this is for scrub typhus, trombiculid mite. Okay, the larva is spreading the infection, which you can identify by its 3 pairs of leg, not tick. Trombiculate mite है ये, and what is the agent? Orentia Shutsu-gamushi. All right? Okay. Coming to last few things, everybody, can you answer this? Total fertility rates of 4 cities are 2.1, 2.6, 2.7, 2.8. Which of the cities has achieved desirable TFR, total fertility rate? Quickly tell me. We can get questions from this, okay? We can definitely get questions from this. So you can see that there are 4 cities which have 2.1, 2.6, 2.7, 2.8 as the TFR. So which of the city has achieved the desirable TFR? Very good. 2.1. ठीक है. So for the country's population to stabilize, TFR कितना होना चाहिए? For any country's population to stabilize, TFR should become 2.1. This only becomes when net reproduction rate is 1, और ये तभी होता है जब contraceptive prevalence rate has become more than 60%. And as of now, for India, guys, what is the current TFR? For India, the current TFR is already 2. ठीक है, 2 child norm is applicable. Yes. Okay, either son or daughter, any will do. And what is the buzzword with total fertility rate, guys? What is the answer to this? Sorry. TFR का मतलब होता है total children. Okay, so if you see the buzzword as total children means we are referring to TFR. This is an indicator of what? Family size. Complete family size. These are all MCQs which can come in your exam. Can you tell me the answer to this? Tell me, number of live births per 1,000 women in reproductive age group in a year refers to. What is the answer to this? Gross reproduction rate, total fertility rate, net reproduction rate, or general fertility rate? Now this is an expected topic, okay? It can definitely turn up in our exams. It's a very expected topic जो आ सकता है. What is the answer? Number of live births. Now I'll tell you a very easy way to remember. See, सबसे पहले होता है crude birth rate, okay? Which is total number of live births per 1,000 mid-year population. Okay, now everybody in the denominator, are they exposed to giving birth to babies? Mid-year population mein there are adults, there are children, everyone. So can everyone give birth to a baby? No. So we made it a little specific. General fertility rate use kiya humne. What is that? Live births per 1,000 women in which age group? Women in reproductive age group. Now again the thing is that every woman in reproductive age group from 15 to 49 can give birth to a baby. No. Those, are exposed. No. Those who are married. So what did we do? We changed it to marital fertility rate, which is live birth per 1,000 married women, guys. Okay, so here the question was live births per 1,000 women in reproductive rate. So that is general fertility rate. Okay, for total fertility rate, it is total number of children. उन बच्चों में से कितनी गर्ल्स हैं? If you asked, okay, if the buzzword is written girls, that is gross reproduction rate. And how many girls are going to remain alive considering mortality? So that is net reproduction rate. So that is the buzzword for each one of them. Okay, so that you please remember. देखो, gross reproduction rate means girls. Net reproduction rate means you will consider what? Mortality rates. ठीक है? And total fertility rate का मतलब क्या होता है? Total number of children. Okay? Total fertility rate means total number of children. Just read in this order. ठीक है? देखो, सबसे पहले crude birth rate. Number of live births per 1,000 mid-year population. Can everybody in the denominator give birth to a baby? No. So we changed it to women in reproductive age group. Now who is more exposed to giving birth? Married women. So general marital fertility rate. ठीक है? Total fertility rate क्या हो गया तुम्हारा? Total number of children. Okay. Gross reproduction means out of those children, how many are girls? And net reproduction rate, Rubla, means how many of them are going to stay alive, considering the current mortality. So just look out for the buzzword, okay? All right, let us see one more question about maternal mortality rate. Which of the following is true? Can you mark this? Think what is true about maternal mortality. A lot of questions come from this topic, guys, which you must know. Net reproduction rate means how many girls are going to remain alive. So when you see a question, mortality dependent fertility indicator, that is net reproduction rate. Okay, Rubla? All right. Okay, what is the answer over here? Caffeine is saying B. Anybody else? Which of the following statement is true? तो देखो, most common indirect cause of maternal mortality is hemorrhage. No, it is anemia. Denominator includes stillbirth and abortion. No, it is rate. So it includes women in reproductive age group. Expressed as per 1,000 live births, per lakh live births. So let us quickly talk about two definitions which could come in your exam. Maternal mortality ratio and rate. What is maternal mortality ratio, guys? So it is, always remember, first of all, maternal mortality is the only place, ठीक है, जहां पे मल्टीप्लायर क्या है, 1 लाख है. Okay, where the multiplier is 1 lakh. It's the only place where the multiplier is 1 lakh. Okay, nowhere else you have, it's the multiplier 1 lakh. Okay, all right. Now, number of maternal deaths, since it's ratio per 1 lakh live births. Okay, and what is maternal mortality rate, everybody? Can I address your doubt towards the end, Sandeep? Okay, what is maternal mortality rate, everybody? It is nothing but numerator has to be a part of denominator, so that is number of maternal deaths. Again, this is what multiplier is 1 lakh. Okay, but rate hai, so numerator has to be a part of denominator, so women in reproductive age group. ठीक है. And what is maternal mortality, guys? Maternal mortality क्या होता है? Maternal mortality is the death during antenatal period or during delivery period or postnatal. Postnatal means up to 6 weeks post delivery. All right, up to 6 weeks. This is very commonly asked question. ठीक है. What is the reason for direct maternal mortality? Hemorrhage. Okay, and indirect maternal mortality, anemia. If a pregnant woman, slips in the washroom and dies, will you count it as maternal mortality? No, because you have to exclude what? You have to exclude the accidental / incidental causes. तुमने ये exclude करना है, the accidental or incidental causes. If she slips in the washroom and dies, you have to exclude that. Okay, so you need to exclude what? You need to exclude the accidental / you need to exclude the accidental / incidental causes. Okay, what is the current maternal mortality in India? Anybody? What is the current maternal mortality ratio in India? Can you tell me? Current maternal mortality ratio in India, everyone? How much is it? Current maternal mortality ratio. Please remember, it is now 9, no, not 112, not 103, 97 per 1 lakh live births. Okay, that is very good. Someone wrote 97, फिर उसने हटा दिया. So, okay, current maternal mortality ratio is 97 per 1 lakh live births. ठीक है. Okay, one more thing that I want you to tell me, what is the recommended ANC visits now? Recommend जो हम लोग करते हैं is 13 to 14. Okay, they are ideal. But now please remember, according to WHO, the minimum ANC visits or antenatal care contacts, now we don't say it's 4, it is 8. Okay, please remember this. Antenatal care contacts, WHO बोलता है minimum visits अब 8 है. ठीक है। और एक और चीज याद रखना, दैट गवर्नमेंट ऑफ इंडिया के अकॉर्डिंग, ओके, व्हाट इज द मिनिमम ANC विजिट्स अकॉर्डिंग टू गवर्नमेंट ऑफ इंडिया, इट इज 4, ठीक है। बट इन केस यू सी WHO, इट इज डेफिनेटली 8, ठीक है। डोंट गेट कंफ्यूज्ड इन दीज फ्यू पॉइंट्स। ऑल राइट, sorry, can you quickly tell me what is the neonatal mortality rate over here? What is the neonatal mortality rate? Can you calculate neonatal mortality rate? So again, there is only one place where the multiplier is 1 lakh, okay, which is maternal mortality rate and ratios, ठीक है। बाकी सब जगह, whether it's infant mortality, अंडर 5 mortality, neonatal mortality, सब जगह तुम्हारा मल्टीप्लायर 1000 होगा, ठीक है। सो लेट्स कैलकुलेट neonatal mortality rate. Who is a neonate? It is death between which age group? 0 to 28 days. Everywhere it is 1000. And denominator is live births. Please don't forget that, okay. So, okay, I can see some of you saying, so in a given population, total births is 4050, 50 stillbirths हैं, 50 neonates die within first 7 days and number of deaths within 8 to 28 days of life is 150. So what is the total number of deaths over here? 50 plus 150, right? And how much is the live births, guys? 40-50 were the total deaths, जिसमें 50 stillbirths थे, तो live births कितने हो जाएंगे? 4000 into 1000. So this will come out to be 50. Understood? Neonatal mortality rate. Anywhere if they ask you infant mortality rate, this is death between 0 to 1 year per 1000 live birth. If they ask you under 5 mortality rate, that is between 0 to 5 years per 1000 live birth, ठीक है। Remember, only one place where the multiplier is 1 lakh, that is maternal mortality. बाकी सारी जगह तुम्हारा multiplier 1000 है. Will you remember this small thing? Okay, everywhere else your multiplier is 1000. ठीक है. Under 5 mortality rate is also known as child mortality rate. Very good, Dark Knight. Okay. All right. Okay. Now this was asked last time PYQ. Can you quickly tell me who are the at-risk infants over here? Can you quickly tell me who are at-risk infants over here? Is it a single working mother? Does it put the baby at risk? Birth order is more than equal to 3. Birth weight 2.8, weight below 85% expected weight and artificial feeding. So what is at-risk infant? Yes? Anyone? Is single working mother at-risk infant? Yes? Yes. Birth order more than equal to 3? No. Birth order more than equal to 5. Birth weight 2.8? No. This is average birth weight of an Indian baby is 2.8. Birth weight अगर 2.5 बोलोगे ना, then only it is high risk. Weight below 85% of expected weight? No, it is below 70% of expected weight. Artificial feeding. So it is A and E. Okay, very good guys. Look at this. Identification of at-risk infants. Okay, birth weight less than 2.5. Never say 2.8. 2.8 is the average weight of an Indian baby. That is not at risk. Okay. Twins. Birth order 5 and above. Artificial feeding. Weight is below 70% of expected weight. Failure to gain weight during 3 successive months. Child with PEM or diarrhea and working mother or one parent. Okay. These are all at-risk infants. Okay. They are very important guys. Please don't mess up. We have a tendency of saying that birth weight agar 2.8 hai, so that is at risk. No, that is not at risk. Birth weight less than 2.5 kg is at risk. Okay. Similarly, who are the high risk pregnancies? This is an expected MCQ which can come in your exam. So look at this. Elderly primary, age 30 years and above. Short stature में ये आया भी हुआ है. Height कितना? 140 centimeters and less. Not 150, not anything else. Malpresentation, APH, threatened abortion, preeclampsia, eclampsia, anemia, twins, hydramnios, previous stillbirth, intrauterine death, all these things. Look at this, 14 days after expected day of delivery, that is also high risk pregnancy. ठीक है? 3 or more spontaneous abortion, not 5 or more spontaneous abortion. कितने abortion? 3 or more. But birth order more than or equal to 5 is a high risk infant. Clear everyone? Will you remember this? High risk infant and this thing. Okay. Now try out this question from nutrition. I just wanted to share with you the recommended dietary allowances. Can you just try out this? Then we will look at the recommended dietary allowances. Rahul, 35 years, has brought his mother, who is 70 years, to his family doctor for a health checkup. Okay? The family doctor is advising Rahul and his mother on adequate nutritional requirement. Rahul tells the doctor that his weight is 65 kg and he is a teacher. Okay? And his mother stays at home. So according to the latest NIN, how many calories should Rahul and his mother take? बताओ. पहले, Rahul is a teacher. Is he sedentary or moderate or heavy worker? What is Rahul? Rahul sedentary है, moderate है या heavy worker है guys? पहले तो ये बताओ ना. Rahul tells the doctor weight is 65 kg and Rahul tells that he is a teacher. Sedentary worker, moderate or heavy worker? Okay, Hemant has given D as the answer. Good. So teacher is always sedentary. All of you are sedentary guys. Okay, medical students, teachers, all of us are sedentary workers. So Rahul becomes a sedentary worker and his mother is an elderly. So now what is the energy guideline which is prescribed? So first of all, let us go and have a look at this table. Can you see this table everybody? Okay, this is according to the latest NIN guideline. इसको कैसे याद रखोगे? देखो, sedentary, moderate, heavy. ठीक है? For a man, 2100 कर लो, 2700 कर लो. And the same energy which is required for sedentary and moderate worker man, it is the same for a moderate and heavy worker female. Can you see? 2100 and 2700. And for a woman, 1660, you can do it as 1700. Multiply it by 2, 3400. Can you remember it this way, everybody? Okay. But what about an elderly female? Elderly female requires 1500 kilocalories. Okay. Elderly female requires 1500 kilocalories. So considering this, man है Rahul sedentary, तो 2100 लगेगा उसको, and she is a female, so 1500 kilocalories. If it was an elderly man guys, then he would have required 1700 kilocalories. Okay, but she is an elderly female, so she requires 1500 kilocalories. Is it clear everybody? The energy requirements, will you remember this? Okay, 2100, 2700, the same as woman, moderate and heavy. ठीक है? All right. Okay, yes, but you are not moving. There is no movement. Even if I am sitting and studying the entire day, कोई movement नहीं है. ठीक है? इसीलिए हम लोग sedentary है. Now look at this additional requirement according to NIN guys in pregnancy plus 350 kilocalories and lactation 0 to 6 months plus 600 and plus 520. Now I'm going to show you a question. Okay. Ideally guys, in the first trimester, no extra calorie needed. Okay. No extra calorie needed. Ideally in the first trimester. So look at this question. Can you answer this one? Which of the following is the correct calorie requirement in a 12-week pregnant female? Anybody? Anybody? What is the answer? Ideally, first trimester में कोई additional calorie नहीं चाहिए. So out of this, what is the correct? You don't need anything in the first trimester. 300 in all trimesters. I just now said first trimester you don't need any additional calories. 400 in the third trimester. So listen to this. Okay, first trimester no calorie additional. Okay, no calorie additional. All right. Second trimester, we will need 350 kilocalorie plus, and in the third trimester plus 450 kilocalorie. So based on this, your answer more closer is 400. Okay, so unless and until it's mentioned NIN, you can go with this as your answer. Is it clear, everyone? Did you understand this? Okay, so that is very very important question. Ideally first trimester में हमें कोई extra calorie नहीं चाहिए. So you can remember this, which I have just said. First trimester 0 kilocalories, second 350, third trimester 450. Okay, but NIN says that throughout pregnancy it is plus 350. Okay, all right. Now you all know this is Anemia Mukt Bharat. Quickly answer this. This is one of the most expected MCQ, guys. Okay, so we have some more time to go. Tell me the answer to this. What is the prophylactic iron and folic acid dose for pregnant female under Anemia Mukt Bharat? बताओ, ध्यान से पढ़ो. Very good. 60 milligram iron, 500 microgram folic acid, and don't mark it weekly. No, it is daily. Okay, so just have a look at this. I have already made a table for you. Okay, so you can go through this table. This is according to Anemia Mukt Bharat. 6 to 59 month old 20 and 100 bi-weekly. 5 to 9 year old children 4 and 4, 45 and 400 weekly. 10 to 19 year old adolescent को हम लोग कौन से कलर का गोली देते हैं? ब्लू. वी गिव देम ब्लू टैबलेट्स. 60 500 वीकली. 20 to 49 60 500 weekly, but pregnant lactating mothers we have to give them daily. But if in the exam you get blue color tablets, remember they are blue color tablets for adolescents. Iron की नीली गोली. Which level of prevention is this? Anybody? Anemia Mukt Bharat, कौन सा level of prevention है? Quickly tell me. Which level of prevention is Anemia Mukt Bharat? Primordial, primary, secondary or tertiary? You are giving prophylactic iron and folic acid supplementation. Caffeine. There is no iron deficiency anemia right now. We have to prevent it. So which specific protection? Very good. ऐसे भी ना कोई भी word if you see prophylaxis, okay, since this is prophylaxis, always remember whenever you say prophylaxis, it is primary or specific protection. ठीक है? Very good. Next, what is this logo? This logo is expected again this time. बताओ ये किसका logo है? Yes, 6 into 6 into 6 strategy. Okay. Quickly tell me, what is this logo? This was initially called as midday meal. Do you still call it as midday meal? No. This is Pradhan Mantri Poshan Shakti. Okay, this is Pradhan Mantri Poshan Shakti. This was earlier midday meal. None of you wrote the correct answer. Okay, Samjad wrote Poshan something. Very good. This was earlier midday meal, guys. Okay, this was earlier midday meal. Now it is PM Poshan Shakti. Okay, and this provides us 1/3 calories and half of protein. Okay, and now what have we included under this? This is under Ministry of Education, yes, and now we have also included under this Bal Vatikas plus class 1 to class 8 students. ठीक है, प्राइमरी एंड अपर प्राइमरी. बट अब हम लोग इसके अंदर कौन इंक्लूड कर लिए? बाल वाटिकास ऑल्सो. दैट्स द न्यू अपडेट फॉर दिस प्रोग्राम. ठीक है. So this you can, what is this one? This is Poshan Abhiyan. Okay, just have a look at this logo. Pradhan Mantri's overarching scheme for holistic nutrition. Okay, in this we are trying to reduce the prevalence of low birth weight, underweight. Okay, and we are also trying to reduce the prevalence of all these things by 2% point. और anemia का prevalence हम लोग कितना कम कर रहे हैं? 3%. I just want you to focus on this logo. This is expected. Okay, Poshan Abhiyan का logo is equally important. What has happened to this man? Quickly बताओ. इस आदमी को क्या हो गया? One of the most, yeah, stunting also. Let's put here stunting also. Thank you. Stunting also, right? By 2% point. Anemia by 3% point. Good, Neelam. Okay, what has happened to this man? Very good, he is suffering from niacin deficiency. Okay, so what has happened to him? Pellagra, one of the most expected questions. Castle's necklace, bilateral dermatitis over sun exposed areas, and we all know that tryptophan, okay, gets converted into niacin. So 60 milligram tryptophan gives us 1 milligram of niacin, everybody. There are 6 Ds. There are 6 Ds, MS. So what are those 6 Ds? Diarrhea, ठीक है, dermatitis, what else? Diarrhea, dermatitis, dementia, delirium, depression, death. और अभी भी बहुत सारे बच्चों को कंफ्यूजन होता है. दिस इज सीन अमंग मेज ईटर्स, राइट? यू सी दिस अमंग मेज ईटर्स. अमंग मेज ईटर्स व्हाट इज देयर? देयर इज एक्सेस ऑफ ल्यूसिन. प्लीज डोंट से डेफिशिएंसी ऑफ ट्रिप्टोफैन. नो, देयर इज एक्सेस ऑफ ल्यूसिन विच प्रिवेंट्स द कन्वर्जन ऑफ ट्रिप्टोफैन इनटू नियासिन. ठीक है, अमंग मेज ईटर्स, ज्वार एंड sorghum eaters also the same thing. There is excess of leucine. Okay, quickly answer this. A person after consuming an allegedly adulterated food develop bilateral swelling of legs, diarrhea, glaucoma, cardiac failure. Again, this topic is expected. क्या हो गया इसको? The toxin most likely to cause the symptom is. So he has developed bilateral swelling of legs, diarrhea, glaucoma and cardiac failure. Very good. So he is suffering from epidemic dropsy. So what is the toxin in this? In this what happens? Contamination of which oil with which oil? Mustard oil with argemone oil. And what is the toxin in argemone oil, guys? Argemone oil में कौन सा toxin होता है? Sanguinarine. This is an expected question. It can lead to cardiac failures and glaucoma and death also. ठीक है, mustard oil with argemone oil. And the toxin in argemone oil, everybody, is sanguinarine. But look at this image. Can you see this image? This is the image of epidemic dropsy. Okay, this here you can see there's bilateral non-inflammatory edema. This can come. There is what? Non-inflammatory pitting edema. ठीक है, ध्यान से देखो इस image को. There is non-inflammatory edema, guys. Okay, and this was asked in INI-CET. So this is what? Argemone mexicana flower. Okay, this is Argemone mexicana flower, guys. The very beautiful, it's very beautiful, but then it's a weed. ठीक है, ये एक weed है जो मस्टर्ड की खेती के पास, आपको मस्टर्ड प्लांटेशन के पास, close by to the mustard plantation it grows. Okay, another food adulteration topic which is expected. Can you answer this? People of a community are consuming khesari dal for last few years. Letharism prevention step in the community are all except. Very good. DEC. DEC is for controlling of filariasis, not for khesari dal consumption. Okay? So what is happening over here? The person suffers from neuroletharism, guys. And neuroletharism में कैसा stage होता है? ये देखो, there can be one stick stage. So in this consumption of khesari dal, okay, or you can also say khesari dal, okay, Lathyrus sativus, at least the person is consuming for 6 months. Okay, 15 to 30% दाल रोज खा रहे हैं. और इसमें टॉक्सिन क्या होता है? What is the toxin? BOA. Okay, the toxin is BOA. This is spastic paralysis, okay, of the lower limbs. Plus, this crop has been banned. If the question says the person is hailing from some endemic areas like Bihar, UP, it is hinting neuroletharism. Okay? We have banned the crop. Which vitamin was earlier being used for its prophylaxis? Vitamin C. Parboiling can also be done. Okay, parboiling was a technique which was done. Also, steeping was a technique which was done. But now we have banned the crop. Okay, but this crop is similar to kaun sa dal, guys? Anybody? आज भी today also people are illegally growing this crop, okay, and they are mixing it with which dal? See, this crop is being illegally grown now also. This is Lathyrus sativus, ठीक है, and people are mixing it with which dal? It is similar to arhar dal, okay, so remember, similar to arhar dal. Arhar dal is the sambar dal, so it's similar to arhar dal. People are still growing it and mixing it with arhar dal, ठीक है. Okay, quickly tell me the answer to this. As per WHO recommended standards for floor space, a space of 90 to 100 square feet can accommodate. So we'll just quickly see some questions from environment which can come. For overcrowding, please remember, for overcrowding you have a floor space criteria. Okay, what is floor space criteria? One person needs 70 to 90 square feet. Okay, two person over here requires 100 to 110 square feet, guys. Okay, now please remember, one room may, if there are more than 2 persons, it's overcrowding. 2 room may, if there are more than 3 persons, it's overcrowding. Okay? Now over here there is also one more criteria which is known as what? Sex separation criteria. Okay, sex separation. Sex separation means 2 individuals who are more than 9 years of age, not husband and wife, are obliged to sleep in the same room. अब यहाँ पे देखो, one adult would require how much this thing? 70 to 90. 2 adults would require 100 to 110. Now a child of 8 years, children up to 1 year are not counted, and 1 to 10 years पे कितना count करते हो आप? उसको half count करते हो, ठीक है. So a child of 8 years will be counted as half, 2 years will be counted as half. So total there are 2. So 2 would require a space of 100 to 110. But look at option D, guys. One adult, okay, one child of 6 years will be counted as half, and this is 0. So 1 and half. So 1 and half को कितना space चाहिए? 90 to 100 square feet. So your answer becomes option D. All right? Okay. All you need to remember for overcrowding is children less than 1 years are not counted, and 1 to 10 years everybody are counted as half. All right? Okay. Tell me the answer to this. This is the last time PYQ. Brightness of a point source is measured in candela. ठीक है? देखो. Let me just revise one small thing. Okay? Here this is your study table. You are this person. You want to study. So you switch on a light or you lit a candle. So you've lit a candle like this. The candle is bright or it's showing its power. ठीक है? So power of a light source, or we can say intensity of a light source, or we can say brightness of a light source, that is measured in which unit? Luminous intensity, candela. Now the light starts to flow. So flow of light, everybody, is flux. It looks like it's flowing through a lumen, a tube. Then the light falls on this surface, illuminates it. So LUM की जगह तुम्हारा unit क्या हो गया? Lux. Now the light which is re-emitted after falling over here, this is brightness. So that is lambert. But if they give you brightness of a light source, that is what? That is candela. Please don't get confused. ठीक है? अगर specifically वो mention कर देंगे brightness of a source, that is candela. Next, quickly tell me, what is this? Red colored dog has bit you. So what do you mean by this? A red colored dog has bit someone. So this is red color. So has bit. That means this is kata thermometer. Again, this is a very famous PYQ which has come. This can measure air velocity and also it can measure cooling power of air. Earlier this was also measuring cooling power of air. But please don't get confused with this one. What is this? This is nothing but globe thermometer, everybody. Okay, and globe thermometer measures corrected effective temperature, or you can also say radiant heat. ठीक है? Red color dog, if you see a red color, this thing, red color dog has bit, kata. Okay, so that is kata thermometer. Okay. People went camping for a week. Best method of disposal of waste. Now, many of you tend to ignore this topic of waste disposal. So, I thought I'll just show you once. Can you tell me, everyone, what is this? People went camping for a week. Best method of disposal. Very good. Burial. So, now I'll give you one question. Okay. Waste, क्या question आएगा? Most satisfactory method of waste disposal, guys. What is your answer? Most satisfactory method of waste disposal. The name is sanitary. Waste means here we are talking about solid waste, okay, or refuse. So it is sanitary landfill, or what is the answer? Controlled tipping. इसमें कौन सा method best होता है? Trench method, okay. What is the best method over here in this? Trench method. You dig a trench. So for a population of 10,000, okay, you need to dig a trench 2 meters and you will require 1 acre of land every year. Okay. If you go, if you are living in a rural area, what is the method that you will use? Manure pit. All these are MCQs. Okay, manure pit. And if you have gone camping, you will go and bury the waste. Compositing is also a technique, but that is not recommended. Incineration is also a technique, but it is not recommended. Okay, incineration is not recommended in India because if you burn the solid waste, we will not get manure. Okay, no manure will be yielded. So we do not refer that. Okay, all right. Some question from BMW. Quickly, ये क्या है? Which color bag should this be disposed in? Red, yellow, blue, green. So we are towards the end, guys. Which color bag should this following be disposed? Quickly answer this. So red. Red में क्या जाता है? Recycles, plastics, tubes. Okay, RPT, red. Okay, all right. Broken glass vials, where do you discard them? Broken glass vials, where do you discard a glass vial which is broken? Please don't consider it as a sharp. Glass vials will go into blue color containers. Okay, so broken glass vials will go into blue color container. Yellow may goes all infectious waste. Okay, blood bag, where do you put the blood bag into? Blood is red in color, going in yellow bag. Urine bag, okay, urine bag has the letter R in it. This is going in red color bag. ठीक है? Metallic implants, guys, where do metallic implants go? So metallic implants, everybody, they go into blue color bag. All right, metallic implants in blue color bag. What is this? I'm sure you all know this is louse, and louse is a vector of epidemic typhus. So you can remember the mnemonic PRET, PRET, pediculosis, relapsing fever, epidemic typhus, trench fever. ठीक है? This is what is louse. What is the vector for endemic typhus? Rat flea. ठीक है? Okay, now tell me this mosquito quickly. Let's quickly revise some of the mosquitoes. So here you can see a hunchback appearance, but there are no white stripes on a black body. So when you have a hunchback appearance with no white stripes on a black body, it is Culex, right? This is not Aedes. Aedes में white stripes होता है, ठीक है? All right, everybody. So this is Culex. Culex breeds in stagnant water. Does which statement regarding the insect is false? Okay, so it breeds in stagnant water, dirty water. Okay, is it called as sophisticated mosquito? No, sophisticated is Anopheles. Okay, flight range 11 km because Culex is a nuisance mosquito. It's also laying its eggs in clusters. Okay, how many eggs in one cluster? 100 to 250 eggs in one clusters. It also has a siphon tube. Okay, sophisticated mosquito Anopheles है. देखो ये तुम्हारा Anopheles है. It's sitting at an angle of 45 degree plus it has what? Spotted wings. Can you see this? It has spotted wings. So what is this? This is Anopheles. And Anopheles, everybody, because Anopheles is sitting at an angle of 45 degree. ठीक है? This breeds in clean water. Remember that. This is hunchback, white stripes on a black body, ADs. Breathes in artificial collection of water. What is this one, guys? Again, ये hunchback है with long legs. Okay, so what is this? This is Culex. No white stripes on the black body. इसमें कोई, there is no white stripes. Hunchback without white stripes is Culex. Okay, all right. What is this? This is brown or black in color with white spots over here. So this is nothing but Mansonia. ठीक है? Both Culex and ADs have siphon tube. Anopheles has no siphon tube. Okay, whose eggs are these? Whose eggs are these? Can you tell me whose eggs are these? Everybody, is it Anopheles? Is it ADs? Is it Culex or is it Mansonia? Everybody, whose eggs are these? ये किसका eggs है? First of all, these eggs are laid singly and they are cigar shaped eggs. So cigar shaped eggs, everybody, if you talk about, okay, will go for what? Will go for your ADs. Okay, cigar shaped is ADs. So just look at these eggs. ये है तुम्हारा boat shaped. Okay, this is what? Boat shaped. Boat shaped with lateral floats. Okay, if you see this boat shaped, Mansonia is always brown or black in color. ठीक है, MA Mansonia हमेशा brown या black in color होगा. Boat shaped with this lateral floats. Okay, boat shaped with lateral floats, everybody. This is what? Boat shaped with lateral floats. If you see, this is Anopheles. ठीक है, this is Anopheles eggs. So you can see over here, ADs is cigar shaped eggs. ठीक है, cigar shaped eggs. ठीक है, all right, okay. This is Mansonia egg. Now, if you look at Mansonia, Sonia से star shaped. ठीक है, Mansonia is star shaped. And when you talk about the larva, if it is resting like this, no siphon tube. ठीक है, अगर कोई भी siphon tube नहीं है, that is Anopheles. But in case you have a siphon tube like this and like this, okay, long siphon tube Culex and this is ADs. ठीक है, everyone. Alright, this is how you're going to identify. Any question can come up. Now, this is a PYQ. Quickly tell me, WHO steps approach is done for. Why do you have the steps approach? Step 1, 2 and 3. This is for what? Is it for treatment? Is it for incidence? Is it for evaluation? So, WHO steps approach is for surveillance of risk factors, not for treatment, not for evaluation. ठीक है? पहले स्टेप में वी आर गेटिंग अ क्वेश्चनर फिल्ड. दैट मीन्स आई एम टेकिंग योर personal and lifestyle details. Okay, we are taking your personal and lifestyle detail. In second step, we are getting anthropometry measurements, and in the third step, we are getting lab investigations done. But always remember, it is for risk factors, not for evaluation or treatment. Since they gave steps approach last time, इस बार ये दे सकते हैं. What is tracking of BP, everybody? What is tracking of BP? What is tracking of BP? Can you tell me? बताओ, ट्रैकिंग ऑफ बीपी क्या है? सो वी हैव अनदर 15-20 minutes to go, guys. Okay, tell me what is tracking of BP. You have to keep a track of blood pressure from childhood to adolescent. ठीक है, all right. Okay, चलो बताओ, ट्रैकिंग ऑफ बीपी क्या होता है? कीपिंग अ ट्रैक ऑफ पर्सन विथ हाइपरटेंशन टू फॉलो अप? नो. चेक बीपी एट रेगुलर इंटरवल्स? नो. व्हाट इज ट्रैकिंग? Track a person. So you are tracking a person from childhood into adult life. That is tracking. None of you answered it correctly. Why? You have to keep a track. You have to track a person right from childhood to adulthood. Okay. If the BP remains low, if the person remains low, hypotensive in childhood अगर है, ठीक है, will remain hypotensive in adulthood also. ठीक है, will remain hypotensive in adulthood also. And if the person is hypertensive in childhood, okay, अगर hypertensive है childhood में, so he will be hypertensive in adulthood also. Okay, that is what is tracking phenomenon. Track from child to adult. This is the image. This can come in your exams. ठीक है. ये क्या है? PYQ from FMG exam, this thing, sorry, from NEET PG exam. What is this? This is, बोलो, rule of halves. Okay, rule of halves. Of course यूजफुल होगा. रूल ऑफ हाफ्स इज फॉर हाइपरटेंशन. ठीक है, चलो नेक्स्ट. दिस इज द लोगो फॉर NPCDCS. So I want you to remember some new inclusions that have come. We have added COPD, we have added CKD, we have added rheumatic heart disease, okay, and we have also started included Ayush modalities in NPCDCS. Okay, so I want you to focus on the logo. Okay, which is the highest group of HIV AIDS, guys? Which is the highest group, highest population at risk? This had come once. पूर्वी रूल ऑफ हाफ्स होता है ना, टोटल पॉपुलेशन में ओनली 50% आर अवेयर दैट दे हैव हाइपरटेंशन, 50% दोज हु आर अवेयर आर ऑन ट्रीटमेंट, एंड आउट ऑफ दोज 50% ओनली हाफ आर गेटिंग एडिक्वेटली ट्रीटेड. ठीक है पूर्वी, वेरी गुड. हाई रिस्क ग्रुप्स इज होमोसेक्सुअल मेन आउट ऑफ दिस. ओके, so look at this. I just wanted to clear this. Many of you have a doubt in this, but if I ask you what is the most common mode of HIV transmission, batao to what is the most common mode of HIV transmission, guys? What is the most common mode of HIV transmission? It is heterosexual. But which route has maximum efficiency? Which is the route with maximum efficiency, guys? Which route has maximum efficiency? Please don't get confused. ब्लड ट्रांसफ्यूशन. अगर किसी को STD है ना, देन द रिस्क ऑफ HIV इंक्रीजेस 10 टाइम्स. ठीक है, ऑल राइट. क्विकली टेल मी, JSY में व्हाट इज द इंसेंटिव्स विच आर बीइंग प्रोवाइडेड अंडर JSY? JSY इज टू इंक्रीज व्हाट? इंस्टीट्यूशनल डिलीवरीज. ओके, इट इज टू इंक्रीज इंस्टीट्यूशनल डिलीवरीज. सो वी वर गिविंग इंसेंटिव्स टू आशा वर्कर्स as well as to pregnant women. How will you remember? Asha worker will always get less money than the pregnant women, first thing. And in rural areas, both Asha and pregnant women will get more money. ठीक है, so इसको तुम कैसे याद रखोगे? देखो, let us come to this chart. Okay, Asha worker will get less money than woman, than your mothers. ठीक है, so Asha worker in rural area को मिलेगा 600, 600, urban area 400. But in rural areas, pregnant woman will get 1400 in low performing state and half of that in 700. Urban area, woman will get a little less. This is 1000 and this is 600. That's how you're going to remember it. Please don't get confused. ठीक है, everybody, is it okay? All right, always remember Asha workers are going to get less money than the mothers, but in rural area everybody is going to get more. So 600 in urban area, Asha 400. This can come in your exam. So the question was, अर्बन एरिया में है तो कितना पैसा मिलेगा? तो आशा विल गेट 400 and 1000 to the mother. Okay, 1000 to the mother and 400. Is it clear everyone? ठीक है, she is in the urban area. Don't forget this, it can come. Now look at this logo, 9th of every month. Iceberg is not followed, Lakshya, only by 3 diseases now. Measles, ठीक है, rabies and tetanus. Okay, in mumps also we have seen in rubella also we are seeing subclinical cases. Have a look at this logo. This is Pradhan Mantri Surakshit Matritva Abhiyan. 9th of every month, free antenatal services are being provided, particularly to women in 2nd and 3rd trimester. This is a logo of which program, everybody? ये किसका लोगो है? दिस कैन डेफिनेटली टर्न अप इन योर एग्जाम्स. दिस इज लक्ष्य. ओके, लक्ष्य इज टू इम्प्रूव व्हाट? लक्ष्य से क्या इंप्रूव होता है? लेबर रूम क्वालिटी. ओके, सो आई वांटेड यू टू फोकस ऑन दिस लोगो. ओके, बिकॉज दिस कैन कम, इट हैज अ वेरी गुड लोगो एंड द लेटेस्ट वन इज सुमन. व्हाट इज द स्पेशलिटी अबाउट सुमन? व्हाट इज द आंसर टू दिस? बताओ quickly, what is the answer to this? Launched in 2019. This is the latest scheme. Please don't forget it. I want you to revise it and go. It can come. क्या है इसका आंसर? सोचो. Lakshya ka answer. Quickly guys, launched in 2019. It is an initiative for zero preventable maternal and newborn deaths. Includes women up to 42 days. Launched by Ministry of Health. Only Nikshay has so far put his answer. What about the rest? I'm not moving forward. I need your answer quickly. This was launched. Very good. Sudha has got it correct. It does not include up to 42 days. The best thing about Suman is it is including mothers up to 6 months post delivery. Okay, it is now including mothers up to 6 months post delivery. Is it clear? This is the first initiative which is including mothers up to 6 months post delivery. So that was the wrong answer. Okay, not 42 days, 6 months. Yaad rakhna, that's why I brought this. I'm sure everybody remembers Ayushman Bharat. This can definitely turn up in your exams. So Ayushman Bharat mein I want you to remember the financial protection guys. Financial protection kitna hai? 5 lakh per family per year hai. Up to and number of family members is no restriction. Okay, number of family members is no restriction. But what is the answer to this? Hospital with 10 beds can also offer the services. Okay, not 100 beds, it's hospital with 10 beds. Okay, let's go to this thing. This was a PYQ. Tell me community health center for urban areas. I will share the PDF on Telegram. We just have to sum up now in 10 minutes. So quickly tell me which is true regarding urban community health center requirement in an area. क्या है इसका सही आंसर? C नहीं. What is the answer? Why are you getting confused between B and C? No. See, when you talk about urban healthcare delivery system, okay, so remember one thing, at the primary level, you have an urban PHC. This is for 50,000 population, okay. But at secondary level, you have an urban CHC in metro city and non-metro city. So metro city is for 5 lakh population, non-metro is for 2.5 lakh. यहाँ पे होता है 100 बेड्स, यहाँ पे होता है 30 to 50 बेड्स guys. And it is a referral center for 5 to 6 urban PHCs, not 2 to 3. So the correct answer was option B. Alright, 100 beds are present. This can definitely turn up in our exams. This I have already told you. Asha worker, quickly tell me, is she a key health functionary of NRHM? Yes. Proposed norm of Asha is 1 per 1000? No. Proposed norm is 2 per 1000. But what is the existing norm guys? What is the existing norm? That is 1 per 1000. But हमने propose क्या किया हुआ है? 2 per 1000. Minimum education 10th pass? Yes. Age group 19 to 45? No. 25 to 45 years. Accountable to village panchayat? Yes. So your answer is A, C and E. Okay, she is selected by whom? She is selected by village panchayat. Village panchayat, okay. But she is trained by ANM and Anganwadi worker. And what is the duration of training everybody? The duration of training is 23 days. Age group is 25 to 45 years. Okay, everyone. Alright, population norm is 1 per 1000. So I think that's it. Okay, yeah. What is the correct sequence of events in a communication cycle, guys? One more question, we'll do it. She can be a married woman, separated, divorced. Okay, she can also be a widow. Alright, but she cannot be a single lady. Avinash, okay? So see, there is a sender who is going to send a message through a proper channel to a receiver, that is the audience, and we will take the feedback from the audience. So receiver may, it has to generate an awareness, then it has to generate an interest, then only I am going to evaluate, and then only I am going to adopt it. Okay, so that is your answer. All right, everybody, unless the message is interesting to me, I am not going to adopt it. Evaluation is not the end. I am only going to bring about a behavioral change in me when the message sounds interesting to me. Awareness, interest and adoption. ठीक है? All right, just a few points about disaster. Can you tell me? Gastroenteritis is the most commonly reported disease in post-disaster phase. True or false? Gastroenteritis is the most commonly reported disease in post-disaster phase. Is it true or is it false? Of course, this is true. We all know. Yes? Vector-borne diseases will not appear immediately. This is also true. Vector-borne diseases take time to develop post-disaster. Zoonotic diseases, leptospirosis, ये सब तुरंत हो जाता है. वेक्टर बॉर्न को टाइम लगता है. Displacement of domestic and wild animals will increase, true. But does WHO recommend typhoid and cholera vaccine in routine use? No. All vaccines contraindicated except all vaccines contraindicated except which one? Except measles. That too in children within 3 days of exposure. Okay, within 3 days of exposure, everybody. That is an important point that you have to remember. But if you talk about health professionals, guys, तब तुमको कौन सा वैक्सीन देना है? All vaccines will be given except all vaccines are given except which one? Except measles. ठीक है? So that is very important. And I'm sure everyone remembers the disaster cycle. You all remember the triage, guys. सबसे पहले होता है red color. Yes. So first we have the red color. Red color is 0 to 6 hours. High priority. Then you have yellow or you have blue. That is 6 to 24 hours. Medium priority. Green is what? Green is ambulatory. And what is the black? Black is dead or moribund. Okay. Black is dead or moribund. ठीक है? Okay, so remember these phases. Chlorination is the best. Ensuring safe water supply and sanitation is the best step post disaster. All right, last thing, can you tell me this? A 40-year-old man who works in a textile company visited hospital for routine health checkup. He prepares dyes. Which of the following investigation would you recommend? इसमें बताओ. Which of the following investigation would you recommend? PFT, LFT, यूरिन एग्जामिनेशन, कंप्लीट ब्लड काउंट. क्या रेकमेंड करोगे इस बंदे में? ही इज वर्किंग इन अ डाई इंडस्ट्री. So dyes matlab he is at risk of bladder cancer, and bladder cancer may most important presentation is hematuria. So urine examination is what you're going to recommend in him. Okay, dyes is bladder cancer. So just look over here. I'll tell you what comes in your exam. Please remember benzene is leukemia. Last time they gave you benzidine. Okay, now D for bladder, D for bladder, benzidine, D for bladder. This has come in your exam. Okay, benzidine, D for bladder, benzene is leukemia. Vinyl chloride आया हुआ है liver cancer, PAH आया हुआ है scrotum cancer. Okay, these are some important ones. Asbestosis we all know, most specific is mesothelioma. ठीक है? All right. Okay, one more question. Quickly tell me, a worker with a history of 30 years working in a cardboard manufacturing firm develops breathlessness and cough. X-ray shows mottling. Disease most likely is. बताओ. So cardboard manufacturing में he has developed mottling. Why? What is the most common manifestation? This has happened because of what? Not asbestosis, no, bagasosis, because the remains of sugarcane industry are used in cardboard industries. ठीक है? Sugarcane industry का remains are used in cardboard manufacturing factories. ठीक है? ये bagasosis है, not B. Bicystinosis नहीं है. This is bagasosis. Okay, the remains of a bagaceous industry, all right, are being used in the fibrous residues are being used in cardboard manufacturing industry. All right. Okay, now look at this, everybody. Risk of pneumoconiosis quickly. See, if you are working in sandstone industry, granite, pottery, ceramic, glass, building construction, you are at risk of silicosis. सीमेंट फैक्ट्री में काम करोगे, एस्बेस्टोसिस, गो थ्रू दिस लिस्ट लेटर. कोल माइंस में एंथ्राकोसिस, ओके. फोटोग्राफी में बैरिटोसिस, ओके, आई एम जस्ट फिलिंग इट अप फॉर यू. टेक्सटाइल में बाइसिसिनोसिस, ओके. cane sugar, paper, cardboard, bagasosis, okay. And last but not the least, agricultural industry, moldy hay, okay. Moldy hay, farmer's lung, basically farmer's lung. Iron mines में siderosis, okay. This list is important, you can go through that later. I'll be sharing the PDF on the Telegram group. Okay, one more thing, quickly tell me, a child is between -2 and -3 SD. What should be done next? -2 and -3 from growth charts. -2 and -3 के बीच बच्चा क्या होता है? So this is a WHO growth chart, Indian growth chart, ICDS. This is upper reference curve which corresponds to 50th percentile for boys, okay. This one is lower reference curve which corresponds to 3rd percentile for girls. Now this is 0, -2 SD, -3. तो अगर कोई 0 और -2 के बीच है, that is which color zone? Green, proper growth. -2 and -3, okay, if somebody is between -2 and -3, the person is mild to moderate, mild to moderate. But if the person is below -3, guys, यहाँ पे, okay, then between -2 SD to -3 SD, mild to moderate malnutrition. Below -3 SD is severe. So in mild to moderate malnutrition, you don't have to refer, घर में बच्चा रख सकते हैं. Child moderately malnourished, mother given advice, okay. But if below -3, you have to immediately refer the child. This was asked last time only. This is 0, this is -2 SD, this is -3 SD. Clear everyone? Okay, growth charts can definitely come in your exam. Okay, now one question of ESI Act. ESI Act involves all those working in restaurants. Okay, which of the following are false except? Can you answer this? Alright, all of the following are false except. All of the following statements about ESI Act are false except. Batao, involves those working in restaurants. Actually true, it does not involve mines, okay, defense and railways. 100% wages in temporary disability, no. 90%. Extended sickness benefit for 91 days, no. Extended sickness benefit is at 80% of wages for 2 years, ठीक है. Workers pay 1.75, absolutely wrong. Workers कितना pay करते हैं? So you must know employee contribution is 3.25 and employer contribution, if I talk about, is 3.25% and employee का contribution कितना है guys? 0.75%. Run by state government. Is it run by state government? No. Majority of contribution is by central government. देखो, central government contributes 7/8 and state government only contributes 1/8. Okay. Alright, so that's an important ESI Act पढ़ लेना. Quickly tell me, expected some international organization. Where is the headquarter of this organization? Where is the headquarter of this organization? USAID. The headquarter of this is in Washington. ठीक है? Okay. UNFPA, all the organizations which start with the UN have their headquarters in New York. ठीक है, सारे जो UN से start करते हैं have their headquarters in New York. This is UNESCO. This is not going to turn up. This is for culture and science, so it's not that important. UNICEF has its headquarters again in New York. Okay, it starts with the UN. World Health Organization, Geneva, founded on 7th of April 1948. UNICEF का headquarters, UNICEF में याद रखना the Gobi FFF campaign. That is very, very important. Okay. Female growth monitoring, ORS, breastfeeding, immunization, female literacy, family planning and education. Okay. फूड सप्लीमेंट्स. फाओ का हेडक्वार्टर कहाँ है? रोम में है. वील ऑल गो टू ईट आवर फूड इन फाओ इन रोम. ILO का हेडक्वार्टर कहाँ है? जिनीवा में है. ओके, ILO इन जिनीवा. This is what? This is World Bank. Where is the headquarter of World Bank, everybody? You can, this is the last thing, so you can just go through this in the PDF also. I just want to tell you one last thing, guys. New York में किसका किसका headquarter है? Okay, New York में. Remember all that start with the UN, ठीक है? United Nations, UNDP, they framed the SDGs. Okay, UNICEF, all right. Then UNFPA, ठीक है? They have in New York. Geneva में किसका है? The one that have come, WHO, ILO. Then you have, yeah, WHO, ILO, International Red Cross, okay, and also there is one UNAIDS, ठीक है? What about Washington? Washington में please remember there is World Bank and there is one USAID, ठीक है? And last but not the least, one thing which can turn up in the exams, Rome में क्या है? FAO, ठीक है? All right. Last few things. Who is this person? I want you all to see. John Snow, father of epidemiology. This one is Louis Pasteur. Okay, he can definitely turn up in exam. He gave the germ theory of disease and also coined the term vaccine, everybody. ठीक है? ये कौन है? Edward Jenner. All right, Edward Jenner has coined the term vaccination and discovered the first vaccine. This is who? This is, इनका क्या नाम है? James Lind. Okay, who discovered, who talked about scurvy. ठीक है? All right. Then this is Robert Koch. Okay, this is Robert Koch, and of course this one over here is Sir Joseph Bohr. Okay, he has given us the 3 million plan. All right, remember these things can come in your exams. All right, which type of epidemic is this? ठीक है, आ भी सकता है, you never know. Okay, Danida. All right, Danida मैं बता देती हूँ. Danida is funding blindness control program. Let me write it here. Good question, MS. Danida is funding blindness program. Okay, and SIDA is funding which program in India? TB program. Okay, don't get confused. Chalo, which type of epidemic is this? Can you tell me which type of epidemic is this? So here there's a gradual rise, a prolonged plateau and a gradual fall. So this is common source continuous epidemic. Okay, common source continuous epidemic. ठीक है, common source continuous epidemic. All right, there's a prolonged plateau phase. Multiple incubation period में disease हो रहा है. Secondary waves. So like commercial sex worker drinking water from a contaminated well. ठीक है, but what is this? This is person to person transmission. देखो छोटा सा plateau phase है. This is what? पर्सन टू पर्सन ट्रांसमिशन. ये हो गया तुम्हारा प्रोपगेटेड एपिडेमिक. एंड आई एम श्योर यू ऑल नो दिस लास्ट वन विच इज rapid rise, rapid fall, explosive in nature, no secondary waves. This is single exposure point source. Okay, single exposure point source. This is explosive in nature. All cases occur within one incubation period of the डिजीज. एग्जाम्पल फूड पॉइजनिंग. ठीक है, भोपाल गैस ट्रेजेडी, ये सब तुम्हारा किसका एग्जाम्पल है? सिंगल एक्सपोजर पॉइंट सोर्स. ओके एवरीबडी, ऑल राइट, दिस इज ऑब्वियसली द लास्ट क्वेश्चन. बता दो, हेल्थ प्लानिंग में मैनेजमेंट टेक्निक्स एक टॉपिक आता है. ठीक है, बिहेवियरल साइंसेस. कैन यू नेम दिस? दिस इज अ PYQ. रिमेंबर द न्यूमोनिक पोकीमॉन फॉर इट. Pokemon. Okay, P से you have personal management. Okay, personal management. O से you have organizational design. Okay, organizational design. C से होता है तुम्हारा communication. I से होता है information system. And M से होता है management by objectives. Okay, these are all based on behavioral sciences or qualitative techniques. System analysis is quantitative. Just remember the mnemonic Pokemon for it. Okay, everybody, ठीक है? All right, everyone, ठीक है? क्वांटिटेटिव में मोस्ट एक्सपेक्टेड इन योर एग्जाम्स इज कॉस्ट बेनिफिट वर्सेस कॉस्ट इफेक्टिव. ओके, मोस्ट एक्सपेक्टेड, नो दिस. बेनिफिट में यू आर सीइंग द आउटकम इन नॉन मॉनेटरी टर्म्स एंड इफेक्टिव में यू आर सीइंग द आउटकम इन मॉनेटरी टर्म्स. Okay, so that's it. I think I've tried to cover a lot of this. If you have any questions, you can just quickly ask me in 2 to 3 minutes. Everybody, I hope you did not get bored with the session. Program and ministry. Okay, program and ministry बताती हूँ. Program and ministry एक बार बता देती हूँ, ठीक है. चलो, program and ministry में program and ministry बताती हूँ. Okay, so remember, there is one thing that you need to know. Ministry of Women and Child Development. This has ICDS. This has Poshan Abhiyan. ठीक है. This has anything else? Pradhan Mantri Matru Vandana Yojana and Ujjwala. ठीक है, उजावला स्कीम. मिनिस्ट्री ऑफ एजुकेशन के अंदर है तुम्हारा कौन सा प्रोग्राम है? मिनिस्ट्री ऑफ एजुकेशन के अंदर नाउ वी हैव पीएम पोषण शक्ति. ओके, पीएम पोषण शक्ति. दिस वाज अर्लियर मिड डे मील. ठीक है, ये अर्लियर क्या था? मिड डे मील था. मिनिस्ट्री ऑफ Home Affairs. What all are under Ministry of Home Affairs, guys? Ministry of Home Affairs. You are counting the houses. So census. Houses are getting disrupted. Disaster. ठीक है. Ministry of Labor बताओ. Ministry of Labor के अंदर क्या है? ESI Act. Factory Act. Okay, so this is how. Rest every other ministry. Okay, rest all programs. Okay, rest all programs, everybody, all initiatives, everything is under Ministry of Health and Family Welfare. That is for you to remember. Okay, see, nested quiz control again, Drago, I will just tell you. Suppose this is a cohort of children who are born today in a hospital. So what you do is you take their mother's ANC history, you preserve their blood samples, urine samples and stem cells. Then you start following them up. Let's say after 50 years, out of these 100 children who were born today, 10 go on to develop a disease. They become your cases, 90 are your controls. Then what you do, you go back, you take out and analyze the data of only these 10 cases. This is nested control. So nested case control is actually prospective in nature. You can just Google nested case control and my name, you'll get a small video. Okay, you can go through that once, Drago. Okay, everybody, is it done now? All right, everyone. So I hope I have covered all your questions and we have had a good session. Do revise it. The PDF will be shared on Telegram with Dr. Neha. So I will see you again. Rabies vaccine has already been discussed. Okay, in the beginning, you can just go back and look at rabies vaccine, everybody. ठीक है? Crude birth rate and total birth rate is almost the same. It simply means total number of live births per 1,000 mid-year population. Crude इसलिए बोलते हैं because it's giving you a rough idea. ठीक है? All right. So I'll see you again soon. Bye-bye. Have a good day. All the very best. Don't give up and keep revising. Any doubts, any queries, you can check out the PDF on PSM with Dr. Neha Telegram group. Okay. All right. Bye-bye. Take care.